Matt, great to have you on the podcast. It's lovely to be able to talk to you about our topic today, getting into a lot of the issues that are not very commonly understood about organs, glands, and the musculoskeletal system, the emotions, overall health, everything we'll cover, which I've been wanting to do this podcast with you for quite some time. So it's great we can do it today. And what I'd love to do to start with is my usual format is I'd like the listeners to get a deeper sense of connection to who the guest is and what their background is that shaped their viewpoints on the issues that we're going to cover. So could we begin by having you share an overview of what has shaped you as a man and what led you to putting so much time into studying and understanding the connections between organs, glands, mind, body, and all that's related that is a big focus of your work?
Yeah, hi, Paul. Thanks for having me on, firstly.
You're welcome. Thank you.
So I guess my journey technically started in school, where I think you and I had similar experiences in school.
Yeah.
Where, well, yeah, we all know.
We weren't learning enough and getting our questions answered.
No, and I don't learn that way. I'm not good at sitting down and just remembering stuff. So yeah. I left school 16, 17.
Yeah.
Left school and became a greenkeeper. And I think you guys call it groundskeeper. But
you mean at a golf course or?
I was at a bowling green, golf course, cricket field, tennis court. So I've done all that. And I did that for close to a decade. And the blessing in that, in hindsight, was I learned a lot about the soil.
Yeah, good.
So that came in really handy studying nutrition later on. With greenkeeping, I did learn a lot of discipline, but at the same time, my soul was slowly dying inside. And so I started studying personal training, which led me back into nutrition. But I studied nutrition first while I was in Europe. So I lived in Europe for 5 years. And while I was between France and London, studied advanced diploma in nutrition. And back then it was all about food, which I know is a strange concept to some people. It wasn't chemical nutrition. It was more about the actual food. And so that, with the background in soil science, set me up really well. I can't remember what year I started studying CHEK, like your approach.
Mm-hmm.
But I do remember one rainy weekend working as a PT that my mentor at the time, who was an exercise physiologist, we would have meetings throughout the week. And he pulled me aside one time and said, I can see you trying to figure people out and figure what's going on. And I think you'd get a lot out of this guy. So he gave me this DVD. I'm not sure if you've heard of it, Paul, Scientific Core Conditioning.
I think I've heard of it.
It's really good. So one rainy weekend, cleaned my apartment, and then I sat down and started watching it. And by this time, he's given me hundreds of articles, DVDs on everything else. And within about 10 minutes, I was hooked. And I was just blown away with not only the knowledge that you had, but the intimacy in which you were delivering it. And so that really inspired me. And so I remember watching that DVD and thinking, oh, that's me. Oh, shit, that's me. I do that. Oh, I do that. And then it was just rolled on from there. So I started applying the principles to myself, and surprise, surprise, they worked. Then I applied them to my clients, and they started getting better results. But then the PTs in the gym started looking at me and looking at me straight, like, why are you doing a crunch over a Swiss ball? So I channeled my inner Paul CHEK and gave them the anatomical explanation. And they were like, oh, shit, righto. And then just grew from there. And then they started to kind of consult me about their clients.
Right.
So I thought, oh, something in this. So I went on through the program. I can't remember what year that was, 2010, let's say. And during that time, my thirst just grew. And if I have an addiction, it's the need to know.
Mm.
And so I fed that. But it wasn't until I think it was 2011 where Dad got diagnosed with prostate cancer.
Mm.
And then seeing him being treated by what we call a healthcare system was, it blew me away. Seeing your dad in that situation, he basically got bullied into the surgery, and seeing what they were feeding him, cornflakes and apple juice for breakfast.
Yeah.
I was like, no, Dad, don't eat that shit. Don't worry, leave that. I'll go home, make you some food, come back. So I came back here, made him a broth, took it back to the hospital, and the nurses wouldn't let me in with the food.
Oh, my God.
They just said, no, hospital food only. It's safer. It's been screened, blah, blah, blah.
Right.
Fuck's sake. So I made my opinion heard, and had to wait for that lady to finish her shift to go back in. But by then, psychologically, the damage had been done to Dad. And just seeing that, it was like, no, there's got to be a better way. There has to be a better way. And so that really lit a fire in me to study, to learn, just to learn the other ways. And, as you'd know, Paul, you study one thing and then go down a rabbit hole into another thing, and et cetera, et cetera. And so I wasn't very good at studying at school. So my study approach was, starting on one thing like a fungal infection, then ended up, reading about how the pyramids were built. So
that's the rabbit hole effect.
Yeah. So it wasn't exactly linear, but I did come across a lot of stuff. But the time living in Europe was really my rite of passage, because that was when I learnt I didn't need Daddy's approval. I could make it on my own and be my own person. And the person, funnily enough, who I let go of from that sense was the very person I was trying to save in my story. And so I spent a good 10 years at least studying, working 12 to 16 hours a day, learning from anyone and everyone I could. I, met my best mate's a chiro, so we met through that. He grandfathered me into a lot of chiropractic and osteopathic conventions. But the amount of chiropractors, physios, naturopaths, psychologists I took to lunch just to get whatever I could out of them, traveled the world. Obviously, the CHEK system as well, the Visceral system, the Up-Ledger system. And that was, a good 10 years of doing that, which what I didn't know until I stopped doing that ever since COVID was I basically burnt myself out, more so psychologically when I stopped. So the hunger to study more and to know more and all that's still very much there, but I've certainly found that balance now. And I know you had a similar. I know you traveled the world twice a year.
25 years.
Yeah.
Nonstop.
Yeah.
And it led to a very powerful midlife crisis when I turned 50. Took 3 years to come out the other side.
Yeah, I look forward to my crisis. It's going to be a good resting period.
But hopefully you won't need one if you pay attention to the signs now.
Yeah, well, that's what we're learning, right? So there's the body talks to us in many ways, but the medical system sees life through a straw.
Yeah.
And
that's made out of dollar bills rolled up. $100 bills or $1,000 bills.
Yeah, it certainly is. And I guess I inadvertently learnt that the hard way with Dad.
Yes. And so for those that don't know, Matt, you're an instructor for the CHEK Institute. So you do a lot of the teaching for us in Australia. And it's not easy to become an instructor for those of you listening. It's pretty intensive training, and you have to really demonstrate proficiency at not only teaching, but being a practitioner. I won't let anyone teach that's not active in practice, because I don't want talking heads in the CHEK system. And we did go through a lot of the connections between the musculoskeletal system and the visceral system as part of your training. But you certainly have gone quite far, as you mentioned, studying Barrel's system, Upledger's, and and probably many other approaches. So and I know from our years of relationship that you actually do a lot of visceral manipulation work as part of your practice. So you've had and that's really one of the main reasons I wanted to talk to you, is because you have a lot of clinical experience now of what happens with dysfunction of various types in organ systems, gland systems, how it manifests throughout the body, the emotions, the mind. And so that we're going to get into that today, which is going to be exciting for the listeners, because very few people are aware of these things, which leads right to my next question. Matt, it's really clear to me from my own studies of the viscera and the glands that medical doctors, chiropractors, and osteopaths had much more conscious awareness between the connections of the viscera. By the way, the listeners, viscera means organ, and the musculoskeletal system up till about 1950, because I spent years and years studying the history of chiropractic, osteopathic, and the medical system, because I wanted to understand how they shaped their thoughts and what happened. After that, there seems to be a progressive loss of that training and knowledge. So could you share your thoughts on the history of the medical profession's understanding of the connections between the inner and outer body? In other words, the viscera, the glands, the organs, everything inside relative to the outside. Because to me, when I look back through all my studies, other than Francis Marion Pottinger and a very few others, there was a lot of knowledge in osteopathic, chiropractic, and even medical training manuals, and up till about 1950. And then it slowly started to wean out, except for the kind of rare people like Major Bertrand Desjarnette, Pottinger. There's a few others as well. I just can't off the top of my head remember them now, because I haven't studied that stuff in many years. But what's your understanding of this history, and what do you attribute this change to?
Well, I know the Rockefellers they kind of took over the medical system early 1900s. And as you're saying, about 1950, 1960, there was so much money involved into research. It went from results-based to research-based, and then just, I guess, medical pressure to put more faith into the research than what was actually happening with people.
Yeah.
It went from integration to isolation. And then if it didn't exist on paper, then it wasn't a thing.
Yeah, isn't that amazing?
Yeah. So we've lost the drive to try and look for things that we can't see.
For years I worked for 4 years. I worked in the largest physical therapy clinic in San Diego with 22 physical therapists and athletic trainers and 13 surgeons. They had a surgical center there. We were coupled right to a surgical center with orthopedic and neurosurgeons. There were many, because in that kind of situation, what happens is whenever the doctor gives you a prescription for X number of treatment sessions, so it might be 6, it might be 26, depending on the diagnosis and the physician's, determination of what he or she thinks will be the necessary time for treatment. But typically, anytime the patient would go back for the doctor's evaluation at the end of the prescribed period, I would go with them and sit there with the doctor so I could answer any questions the doctor might have as to, what we were doing, how they were progressing. And there were many cases where the patient would say, doctor would be asking him, I'm doing really great. And the doctor would say, well, what did he do with your shoulder? And the patient would say, well, he really didn't work on my shoulder. He gave me a liver detox and I don't have any pain anymore. Now that person came for what they thought was chronic rotator cuff problems, and the doctor couldn't give them a surgery because they would, do MRIs or whatever. There was no tear in the rotator cuff, but they had all the symptoms of rotator cuff pathology. And so the doctors would be chewing me out, like, what the hell are you doing? I sent them to you for shoulder rehab. And I said, well, didn't you just hear the patient? They don't have pain anymore. And so sometimes the doctors would wait till the patient left. Sometimes they were just too, triggered. So they would start giving me shit and, like, what are you doing working on organs? There's no connection between the musculoskeletal system and the organs. And so oftentimes I try not to do this in front of the patient, but sometimes I had to. And I would just smile and say, I have a question for you. What are the symptoms of somebody having a heart attack? And they would look at me. Sometimes they wouldn't answer. Sometimes they say, well, pain in the chest and the left arm. I said, have you ever had anybody walk in here and say, doctor, my heart hurts? No, you haven't. What are the symptoms of somebody having painful menstrual cycles that you end up seeing? Oh, back pain. Good. And so I would just start going down the list of standard medical diagnostic procedures that they use all day long. But they had totally disconnected the fact that what was an innate practice to them had been disconnected in their mind, and they didn't even realize what they were doing.
Absolutely.
Yet they would argue with me that I was doing something wrong, but couldn't deny the fact that the patient sitting right there just told them they had no more pain. And so they would get triggered because I didn't, play around with their rotator cuff or whatever. And I could tell you a long list of those types of stories, but it just used to be mind-boggling to me. I mean, I would have doctors literally screaming at me so loud that everybody in the entire clinic would be going, oh my God, Paul's in a fight with Dr. So-and-so. And, I would just be very patient. So quite often what I would do is I'd go get, what's the medical text? Netter's Anatomy. And I would just open the book to the page that showed the neurological connections to each of the glands and the organs and show, okay, look, this connects to C5, 6, and 7, and then they would just be dumbfounded. It would be like they'd just been hit over the head with a stick and couldn't process the information.
Yeah.
Most people nowadays have some trouble with poor blood sugar balance from stress, inactivity, and suboptimal sleep. Or, if you're like me, you get too busy and skip a meal and then get so hungry that you crave sugar, stimulants, or a quick fix snack. But the blood sugar roller coaster that creates this is just not good for your body and can cause your cells to become resistant. And that may lead to belly fat, metabolic syndrome, cardiovascular diseases, and many more issues. Berberine Breakthrough by Bioptimizers can significantly blunt those sugar cravings and help avoid the energy roller coaster. Stabilizing your blood sugar balance has so many other positive benefits, including supporting a healthy hormone balance, elevating your mood, and keeping brain function healthy. Glucose is also a type of oxidizing sugar, which means high blood glucose can increase oxidative stress and accelerate aging. So if you want to live a long and healthy life, you want to keep your blood sugar even-keeled. Berberine Breakthrough by Bioptimizers is clinically tested to potently normalize blood sugar response and is an invaluable tool in your nutritional toolbox. Now, Spirit Gym with Paul CHEK listeners get 15% off their purchase of Berberine Breakthrough by going to bioptimizers.com/Spirit Gym and use the code PAUL15 at checkout. Bioptimizers offer a 365-day best product ever or your money back guarantee, so you have nothing to lose and everything to gain by trying Berberine Breakthrough.
What comes to mind was a patient that I'm still seeing sort of regularly, but she came to me about a year ago, chronic headaches.
Yeah.
And she was on about 3 different medications and nothing helped. So I started working with her and I noticed a scar where her appendix was. And I started working on the scar and mobilizing the cecum and the ascending colon and the hepatic flexure. And within about 2 weeks, no more headache. and all the other things that she had I think it was right knee pain as well. And I got a phone call from a very disgruntled doctor saying, no, she needs these medications, she needs it for life, or she's going to die, blah, blah, blah. And then I said, look, I worked with her appendix scar. He's like, how the hell does that work? I said, well, first of all, she got the appendix scar when I think she was 7-ish. So the scar is quite acidic. The scar irritates the nerves. The scar migrated to her ileum, created medial rotation of the ileum. Then that tension got picked up by the renal fascia, which goes into the endothoracic fascia, which then merges into the anterior longitudinal ligament of the spine, which then comes up into the cranial fascia. So she actually had a torque through the sphenoid, which is doing like a Chinese burn to her brain. But also it was irritating the obturator nerve through the obturator membrane. So I was creating medial knee pain as well. But then just working with the scar, I didn't touch her knee, I didn't touch her head. And the doctor's like, no, that's false. She needs the medication.
It's false. Well, she has no headaches, doctor. Yeah. How do you call that false?
So, yeah, he thinks I'm some kind of witch doctor now. So,
yeah, well, as long as he doesn't burn you at the stake, we'll be okay.
He tried.
You can't deny results, right? And that's what patients come for. And I would tell doctors, look, did you send the patient to me to do what you wanted me to do, or did you send them to me to help get them better?
Exactly.
They know the answer, but they don't like the answer because they want to have the impression that they know more than everybody else does. And when they find out they don't, they get very insecure. Now, to be fair to the doctors, I have had a number of doctors over the years just be absolutely blown away and just like, oh my God, Paul, how did you figure that out? And then they would like come hang out with me, and I'd be sitting there sometimes for an hour with them, sharing books with them and explaining concepts. And it got to the point where at one point I had 32 or 36 doctors, their nurses or their wives or children on my schedule. I remember one day looking at my schedule for the whole week, and almost every single person on it was a doctor, their nurse, or their family members. And my business just exploded because these doctors that were open-minded realized this guy's actually helping people. So I want to be balanced and not make everybody think all of these doctors are like that, because there has been some amazing doctors I've gotten to know and who have been very beautiful people and really supported me and my work and sent me loads and loads of people to help. Other than the CHEK Institute, I don't know of any professional academic training programs for health and medical professionals that teach an integrated model of assessment for gland and organ and musculoskeletal correlations. Do you know of any other education systems that teach this information other than medical professionals having to go to specific workshops or certification programs like UpLedger or JP Barrell and those types of people?
Yeah, most institutions concentrate in isolation. I've found there's a institution that works on mental health, institution that works on emotional health, physical health, even spiritual health. I mean, there's a coach for everything these days, right?
Yeah, in a surgical ward or it always amazes me. Like in the beginning of my career, an orthopedic surgeon typically would operate on the shoulder, the spine, the hip, the knee. They were orthopedic surgeons. But then it became, I only do shoulders. I only do elbows and hands. I only do knees. I only do hips. I only do the lower spine. I only do the cervical spine. And I watched it get further and further divided. And as that happened, what was even worse is they got very territorial. So if a surgeon was a general surgeon that operated on the hip joint or the knee joint, and the guy next to him was a specialist in that, there'd be a fight between those guys about why are you operating in my territory?
Yeah.
And I saw that, the physical therapist hated the chiropractors. The chiropractors were at war with the physical therapists. The doctors hated the chiropractors. The chiropractors hated the doctors. And I think it was by the grace of God, that the state of California, when I went through my clinical massage therapy training, at that time, you can become licensed as a holistic health practitioner, which required 1,000 hours of training in something to do with health. You could be a massage therapist, a psychologist, a nutritionist. But California had a license called a holistic health practitioner. And the only criteria on the license was that you had to work with anybody using holistic means. So you could do massage, you could do stretching, you could do nutrition, you could do psychological counseling, as long as it wasn't, deep enough that they felt that you were being a psychologist, but you could talk to people about what was going on in their life and things like that. And so the good news is that when I would go to all these workshops and in the applications, I would put holistic health practitioner, they didn't know how to hate me. They didn't really know what that was. And I traveled all over the world. So very few people know what a holistic health practitioner. The only other place in the country that has them is Germany. And there it's a 4-year degree program and they're licensed professionals. And so I got lucky because I fit in this kind of box, like I was a chimera that they didn't know, what is this, and so they didn't know how to hate me. And so it allowed me to get a lot of training all over the world where I could not have gotten it. There's many, many physical therapy conferences and training programs I couldn't have gotten into as a chiropractor or even possibly an osteopath. So I really got fortunate that way.
Yeah, I tell people that I'm a CHEK practitioner. When I say people, chiro, osteo, physio, etc., and they say, "Oh, so you've got 2 wives? Is that how that works?"
That's hilarious.
So that's the CHEK name.
That means at least they know about what we do.
Yeah. So that's been my experience. But again, because I'm on paper, I guess I'm only a personal trainer and massage therapist. So that's all that really matters in Australia, what kind of qualification you have. That's just the box that you sit in. You're not allowed to be a chiropractor and a psychologist. So it's all labels.
Yeah. I'd love it if you can give the listeners an overview of what visceral manipulation is and how it works to restore or optimize gland and organ function. I don't think most people listening, unless they're in the medical profession or CHEK professionals, would have a concept in their mind of what visceral manipulation is.
So visceral manipulation is just quite simply a very, very light, very precise manipulation of the soft tissues surrounding the organ or gland or artery or nerve or vein. And it really is, think of a pebble in the pond effect. It ripples out and you get a treatment today and that treatment's still working for about 2 or 3 weeks, depending on the person. So it's not painful at all. It's not like a massage as you think a massage would be. It's working with a specific part of the organ, specific part of the nerve, stimulating the mechanoreceptors in that tissue in a live feedback loop to the brain to open up communication between brain and body so they can have that conversation and to open up that self-healing mechanism, because the body wants to heal. It wants to detox and it's trying to find its balance point all the time. So visceral manipulation is really getting yourself out of your own way. And I know in osteopathy and chiropractic, they say structure dictates function, which is true to a degree, but also on the other side of that coin, dysfunction often dictates structure.
Yes. Yeah.
So often there's two ways of looking at that. Is a gland, organ, nerve, whatever it might be, is that dysfunctional because of a joint fixation? Or is the joint hugging the internal compression? Because you can cut your arm off and you'll be just fine. But if you squash, impinge, nick an artery or an organ on the inside, it could be potentially life-threatening.
Yeah.
So the entire body will hug that tension. And you can see it in people's posture. You can see it in, even the way people behave and the effect it has
the way
on the
they
psyche.
breathe.
Everything.
Yeah.
I mean, we can live without muscles, but not organs.
Well, I tell people all the time, the muscles are the slaves to the organs. And you may have heard me say it, but I say to the people, what does your colon tell your legs to do when it's full? Squat, not run, squat. What does your stomach tell your body to do when it's hungry? Go find food. What does your heart tell your musculoskeletal system to do when it's empty or lonely? Go find a partner. So you can literally go through the organs and see what their commands are in order to feed the need of that organ, because the organ is really the life source of the individual. Right? Without the organ, you'd just be a robot, right? So that's where the life source, and a lot of our psyche is embedded in and dependent upon the organs. So if we, and we'll get into more of that later, but I think, people need to understand that, and there's what's called the CHEK totem pole. So for any of you want to see that, it took me about 15 years to figure it out, but I designed a totem pole called the CHEK totem pole, which if you go to my YouTube channel, youtube.com/Paul, CHEK live, you can actually see the systems that control which systems in the body are below it on the totem pole. So you can see a hierarchy of control, and you can see where the glands and the organs are at versus the other systems, which I won't go through because it's too long and complex. But it took me 15 years of research and study to actually, and a lot of clinical cases to come across enough patient situations to, I kept having to ask, what's causing that? What's causing that? And then finally I was able to actually correlate all the data and say, so now I can see and I can find anatomical references in literature and in physiological studies and clinical cases to put that together. But the organs are, as you know, quite high on the list of control functions. One of the things, a couple things I wrote down, are you familiar with Wolff's Law?
Mm-hmm.
So Wolff's Law says form follows function. And so there you can see if you have a dysfunction in the natural function of a gland or an organ, it will affect the form of the body, which again affects function. So it's like a circle, right? You disrupt any part of it and the whole thing is altered. The other thing is, yes, I agree with you that organ manipulation, mobilization is generally very gentle, but there have been many cases in my career where people had scar tissue that I had to break up. And adhesions, for example, I've had people like a highway patrolman one time that crashed his car going about 120 miles an hour, hit a boulder about 20 feet high, broke 55 bones. And it took me about probably 8 months to rehab that guy. And I had another guy that was going on vacation with his wife in a plane. They owned a cabin way up in the mountains outside of Seattle, Washington, and a flash storm came and the pilot couldn't see and he flew right into the side of a mountain and it killed the pilot and killed his wife and broke 101 bones. And he had to crawl 3 miles in 3 feet of snow to get to where a rescue helicopter could even see him. And so he had very bad adhesions all throughout his body. And most of his visceral system was completely locked up because of all the bleeding inside. And the other case where I've had to use more of an intense approach is the Ascaris worm tends to build nests in people's colons quite often. And so breaking those things up can be quite uncomfortable. It actually feels, you've probably found them yourself, but it feels like you're putting your fingers into a ball of dry straw, and you can actually sometimes feel it breaking up like dry straw or tiny twigs. So those are some situations that are important. But I think what I'd love to hear you talk about, because I think a lot of people don't really understand organ motility, but I'll share something that was really phenomenal in my learning. There's a doctor in England that has a TV show. I think his name is Morley. I don't even know if the show's out anymore, but he does some really cool stuff. Like he infected himself with parasites, and I think he put radio markers in them, showed how they moved through his body, and showed using cinema radiography, if I remember correctly, but he could actually show you the changes happening in his body. He infected himself once with a tapeworm, if I remember right. But one time he had a video, and he had given somebody, I think it's barium, whatever they take to make soft tissue show up on a X-ray. I believe it's barium. But they used a cinema radiographic technique, which makes an X-ray video, and you could actually watch all the organs moving in real time. The patient was just laying there. And the first thought I had is it looks exactly like the seaweed and the plants when you're underwater in the ocean, how they have a natural wave to them. And having had spent all these years studying all this stuff, I'd never actually gotten to see all the organs working together like that. You could actually see the liver rocking. You could see all the organs moving, and every one of them was like in this natural waving, and with every breath they would change. And if they changed their body position, and you could for the first time see how alive and how dynamic that internal system was. But most people actually think of their organs like components on a stereo stuffed in a box, or like a DVD player sitting next to a television. They don't realize how alive all this stuff is and how important it is.
Are you tired of feeling stuck? Whether you're stuck in your health, your career, or your daily routine, getting out of a rut can feel overwhelming. But here's an opportunity to escape that rut, to break out and transform your life from the inside out. No matter what you feel has been holding you back, you can make a lasting change and reach your physical and mental goals and dreams. The CHEK Academy is the answer, bringing you fulfillment and purpose with step-by-step assistance, guidance, and learning. You'll be equipped to improve your health and, if you choose, guide others through their transformation too. Because the Academy schedule is designed to accommodate those with full-time jobs, you can make this life-changing leap while still managing your regular day-to-day commitments. In year one, you'll gain tools and strategies that really work, not quick fixes that are not sustainable. Starting with Paul's book, How to Eat, Move, and Be Healthy, which helps to build healthy habits, you'll grow on this foundation in Holistic Lifestyle Coach Level 1 online. Integrated Movement Science Level 1 online, and the prerequisites will show you how to exercise with confidence and precision. CHEK mentors and faculty are there to guide and support you as you progress, as well as the community of your fellow students in the CHEK Academy. The fall enrollment is closing soon, so get your application submitted now. Go to chek.group/CHEK Academy. Don't wait any longer to make your vision your reality. Come join the CHEK Academy and become your absolute best self. Apply now at chek.group/CHEK Academy.
So maybe you can talk a bit about motility and maybe a little bit about how you assess that and what do you pick up when you're investigating these things, and how might that trigger off changes? You kind of led us through a little bit of that with the appendix issue.
Yeah, so the organ motility, think of it, each organ has this little dance that it does. And that dance is essential to well-being. When the organ starts to lose motility, what I've found is that the muscles then become a witness to visceral tension. So if it's the lung, pec minor will often tighten up. If it's the kidney, it's going to affect the psoas. The bladder is going to affect piriformis. And so all of these, when the organ starts to lose motility, which you can pick up by your hand, you can feel if an organ's moving and the tissue around it.
But it does take skill. It's not something there's a lot of people that can't learn it. I've tried to teach it to practitioners many times and they cannot feel it.
Yeah.
So it really takes a fair development of you as the practitioner to get your body calm enough and to open your perceptual field enough, or you don't get past the surface of the body. A lot of time people have a hard time just with that.
Yeah, a lot of people have the hard time with, just the surface of the body. And unfortunately, in my experience, a lot of those people are physios and chiropractors.
I know.
Then
it's sad, but it's true.
Yeah, it is. It is. There are some great physios and chiropractors out there, but no one thinks about what's beneath the surface of the skin. And I remember one time I had a patient who had, I think, a pancreatic cancer or liver cancer. I can't remember. But essentially, stage 4, I think the doctor gave him 6 months to live. He came to me just because he was scared, wanted someone to talk to. And so I said, just lay on the table. I just put my hand over his pancreas and his liver and worked on the motility of the pancreas. And he fell asleep during that session. And then he woke up probably half an hour later, feeling a lot lighter. But then he called me the next week, and I barely touched him. All I did was worked on the motility of the pancreas. That was it. And he called me the next week and said, I'm not afraid anymore. I'm not scared to die.
Beautiful.
So just rebooting the motility gave him, in a way, his sense of self back.
Yes.
So the motility is extremely important. I know Burrell works with the motility before the mobility of the organ. And every single kind of physio, chiropractor, osteo I took out to lunch or met with or consulted with, I asked them the same question. And that is, if you had 30 seconds to work with someone, what do? You only had 30 seconds. Burrell said the sphincters of the body and then the motility.
That's
of the
very
organs.
powerful.
Yeah. And yes, that's the first thing I check with patients.
A lot of people have problems there too. And that goes very, very deep in the psyche.
Oh, yeah.
I did a lot of sphincter work on myself when I learned sphincter work, which I learned, interestingly, studying a book on anatomy from about 1933 by a lady named Mabel Todd. And I think there was one or two of the instructors that I studied with along the way that taught variations of sphincter work. But, you know who else I learned that from is Major Bertrand Desjarnet's books. And in what I always do for myself is I test everything on myself before I start using it clinically, because to the degree that I can. But I had really profound meditative experiences. I would have a routine where I would do the eye sphincter, the oral sphincter, and the anal sphincter, and the urethral sphincter. And I would just sort of do them in a rotation, and I would often couple them. I played around with the breathing sequence to see, for example, would the sphincter exercise work better while inhaling or exhaling? And for example, I found if you do a sphincter contraction on the exhale for the rectum, it doesn't have as good of an effect as if you do it on the inhale, because when the diaphragm drops down as you breathe in, the sphincter has to naturally contract to keep the fecal material from being pushed out by the increased pressure on the intestinal tract with the diaphragm dropping. So if you did the contraction on the exhale, you were actually training the body to do something that was unnatural to it. So I would experiment with all this stuff, but I found myself, it would take me into a deep state of relaxation, but I would actually start having really interesting experiences. Like I would all of a sudden find myself having visions of earthworms eating their way through the earth, and very primal things like rivers and creeks flowing through nature. And this would just spontaneously arrive in my inner vision. And I found that the sphincter system is actually linked to the most primordial developmental stages of the evolution of the human body. And because of that, it links into our most primal sense of fear and whether or not we're safe. And so when people have sphincter dysfunctions, they often have this chronic anxiety that they don't know where it's coming from.
Yeah, the sphincters are highly psychogenic. They're very reactive to the psyche, and they often respond to a stress by either completely opening and staying open or shutting down, sometimes even freezing.
Yeah.
And so that's why a lot of people during stress, they won't get hungry, or they'll be constipated or diarrhea.
Yeah.
And similar to you, when I'm doing sphincter work, I'll often get a vision, and it could be of a childhood abuse or just being yelled at or having a fall or accident, whatever it might be. And more often than not, that's exactly what's going on.
What happened, yeah.
Yeah.
You know, it's very interesting, but, you know, as I did all this developmental work over many years, it made me sad that this is such rare knowledge in the medical industry, because it is so pivotal to a person's overall physical, emotional, and mental health. And it's so rarely ever talked about that I think it's, you know, we need more awareness, which is why I wanted to get you on the podcast to talk about these things. And, you know, like the average person would have a really hard time if they were even to search the internet to find sphincter exercises. Most doctors and therapists would look at you like, what the hell are you talking about? You know, yet here we are talking about, you know, if you think of, you know, you look at embryology and the whole body literally grows out of the gut tube. It grows out of the intestinal tract. Your brain, your skin, everything comes right out of the first thing that forms is your intestinal tract.
Yep.
But, you know, like this is, any anatomy professor would tell you that in 10 seconds and agree with you on it. Yet here we have a whole medical system that's lost touch with the fact that if you think of, like you have endo, ecto, and mesoderm, like those are common concepts, but the whole body is built that way from the core out. And so we keep trying to come from the outside to the inside instead of coming from the inside to the outside. And when you have a medical system that just keeps drugging the shit out of people, and oftentimes, unfortunately, the surgeries, as you know, a lot of them are unnecessary, and it's another wound that the body has to deal with, and it leaves a lot of scar tissue and a lot of problems. I've probably had to do as much work on people from the injuries of the surgery as I have people that ended up needing surgery because of a legitimate injury, like a legitimate disc bulge that needed a surgical intervention or a rotator cuff tear that needed to be repaired. But it's just sad that we don't have more awareness of the developmental structure of the body and how that relates to and emerges outward. So if, like we're talking about, if you got a sphincter problem, it can show up all over the place in many, many different symptoms, but it'll get treated by doctors and therapists in all sorts of ways that are never actually coming to the real issue, which just leads people to go. And interestingly, I was doing research for a podcast maybe a year ago, and I found that the number one cause of bankruptcy today in the United States is medical expenses. More people, I think it was about 68 to 70% of people that go bankrupt don't go bankrupt because they're overusing credit cards or spending foolishly. It's because their medical expenses are so high, they can't even afford to buy food anymore, and they have to go bankrupt. Yeah. Which is, when you think about that, it's a really sad situation.
It's sad, and a lot of people are confused. And in my studies, I was blown away, and I'm not putting shit on doctors, but I was actually blown away, generally speaking, how little the doctors knew about the body.
Yeah.
They know a lot about diseases and medication, and that's about it.
And I don't know if you know this, but in the last probably 10 years, most medical schools stopped doing cadaver dissections, and they only teach anatomy now on computer screens. So people don't actually get hands-on training in anatomy. I did 5 cadaver dissections myself over the span of probably 10 years because I wanted to really, not only did I want to see and meet the inner body, but I had a habit of doing any technique such as neuromuscular therapy techniques. Can I actually reach the longus capitis or the longus coli or, you know, any of these things. So I'd be in classes with other therapists and they're like, what are you doing? I said, I'm testing to see, because I got taught this in such and such a class and I want to see if it actually is possible to do this, you know, and it turned out some of the things that I was taught just were not possible. It was just, you know, shall we say made up, but you couldn't do it.
No, it works in a book, but it doesn't.
Yeah, it works in theory, but technically can't be done.
Paul, the last cadaver I did, the lady with the scalpel nicked the colon.
I'm sure that was interesting.
It cleared the room out.
Yeah, that'd be very bad. You know, I just want to share for the listeners, there would be times because of my studies of the visceral system and practicing of it, and I never went nearly as deep as you did. Like I just felt I had too many areas I was developing on, and I had a really good visceral manipulator here in San Diego. She's quite an old lady now, but she was really, really skilled at it. And so I had a number of cases. I remember one case in particular, a guy had a really bad functional scoliosis, but it was really significant. I think probably about a 20 or 24 degree curve in his thoracic spine, which is quite an extreme scoliosis for a functional scoliosis. And so I analyzed his leg length, and he had equal leg length, because typically you'll see something like that when people have a significant leg length or a hemipelvis difference. But he had a normal structure. And so I checked, for example, his rib cage, and his rib cage was just like a block of wood. You know, his ribs barely moved when he breathed, and there was just lots of tension in the intercostal region. And then, of course, I had already done all my HLC paperwork, and I could see from his diet and his lifestyle and from some of the emotional trauma that he had, that my read on it was this guy's carrying a tremendous amount of tension and dysfunction in his visceral system, and he doesn't have normal motility because he was an athlete and his abdominal wall was like a rock. I mean, he's one of these guys that was ripped up, kind of like he was probably about 50, but he looked like, you know, what 50-year-olds look like when they're taking a lot of testosterone replacement, like too ripped and too lean and too muscular for a normal diet and lifestyle. And so I sent him to this lady named Leilani Lee. And when he came back the week later and I reevaluated him, it was like it was a completely different person. And he had only seen her twice. I think two sessions. It might have been even 10 days later that I saw him. But his scoliosis was completely gone. His ribs were moving. He was breathing almost what I would call a normal breathing pattern. A lot of the aches and pains that he had been complaining about were cleared up.
Yeah.
And I used to see cases like that routinely with this lady. Like she was super skilled. And some of the cases were mind-boggling. And then the eyes aren't typically classified in the visceral system from most of the books on visceral manipulation I've studied. But I've had some cases of very, very severe scoliosis and really strange problems. And I studied behavioral optometry. And so I started referring people to behavioral optometry when they failed all the eye tests that I teach you guys, or any of them of significance. And I thought, okay, there's something going on, or some of them had traumas like head trauma and whiplash accidents and things. I remember I had a case, it was actually a level 4 CHEK professional from Chicago, and she had a 52-degree scoliosis and a lot of chronic problems. And I tracked it to her eyes. And she went and saw this behavioral optometrist in Chicago named Dr. Lederer. And I think she'd probably been away from me for maybe 3 months. And she came back for a reevaluation after 3 months of behavioral optometry. And I was absolutely blown away. It was like she was a different woman. That scoliosis was almost completely gone. Her pain was almost completely gone. Like it was something so shockingly dramatic that it just made me go like, oh my God. And so that was one of my early explorations of behavioral optometry, just to see how powerful the eyes were, even on the visceral system and on the entire system of the body. And I bring the eyes up, not because they're classically considered a viscera, they are actually an organ, but they're not usually thought of by most visceral manipulators, because you read books on visceral manipulation, never seen anything about the eyes in there. And that's why I teach in the CHEK system how to analyze the eyes. But there's another example of, look, what percentage of your body weight are your eyes? Like they're, they might weigh 3-4 ounces each at most. I don't know, maybe less than that. They're filled with water or, fluid. And yet they can completely transform your body for better or worse if they're not looked at. So I share these things so that the people listening can understand, like, this is very, very real, all this stuff. And it's a really serious deficit in our medical system.
I mean, it's ironic that people don't think to look at the eyes. And in my experience with the eyes, it's usually the optic nerve that gets tight. Because as we're looking at screens all day, the screen oscillates, which causes the optic nerve to oscillate, and then it becomes quite tight. So it pulls if you were to press on your eye, it should spring naturally. But if it gets stuck into the skull, one half of your head will do that, but the other one will do that and try and rotate, and that will create the spiral. And I've worked with many scoliotic patients, and what I found, if it's in the body around the rib cage, it's usually liver. And the liver will shear itself to try and protect the aorta and the inferior vena cava to minimize compression on those structures, as well as there's always one kidney involved as well, always one. And whether that's the renal vein, the renal fascia, or the inferior lobe itself, there's always one kidney that's under tension. And to give you an idea of what that's like, if you were to put your thumb underneath one of your ribs and just twist that and just see what your body does, your entire body just follows that. And that's the scoliosis comes from.
Yeah. I know you know this, but 85% of all people seeing doctors for musculoskeletal pain and related challenges cannot describe a specific event that caused the pain, such as a fall off a ladder or slipping and falling, or, getting hit by something or someone, a car accident, which is a pretty shockingly high number of people. That's 85 out of every 100 people going to a doctor for musculoskeletal pain cannot tell the doctor what caused the pain. So my question for you, based on all your clinical experience, what percentage of people seeing doctors for structural pain and challenges today do you feel are actually there because of a pain? Their pain's a symptom of referral from or dysfunction in the glands of the organs.
I would say no less than 95%.
Yeah.
Clinically, I mean, anyone who's lived any kind of life has some tension in the visceral system. Absolutely, any kind of life, you will have some kind of tension. We've all been in an argument. We've all been brokenhearted.
Yeah.
We've all got something, and that has to go somewhere. And unless you've, done the work to heal that, accept it, know it, love it, then even then you'll still wear it somewhere. The body records everything. So the subconscious wants to keep us, we're wired to survive.
Yeah.
But we go through an event, but we have to suppress it to maximize our chances of survival in the here and now. Then we forget about it. Or if it's too painful, we push it down further, and that just creates further and further tension. So for at least 95% would come from some kind of visceral, glandular, artery, nerve, even mental health. I had a patient come to me recently, chronic anxiety. And what it turned out to be was he went to Vietnam and he got, the Vietnamese version of barley belly, I guess. And his liver had a bacterial infection, but he didn't know what it was. And the liver had some kind of scarring from that infection, but his subconscious mind interpreted that as anxiety. So that's just an indication of it's not the psychology per se, but it was being interpreted by the body as that.
Yeah, well, I think it might be your liver is so essential to your life. It may be that at the subconscious level, the level of the body itself, having a scarred liver or a traumatized liver from, what could have been a microorganism in there, could actually make the body feel afraid that it was going to die.
Exactly. That's exactly what it was, because the liver is the home, the deep sense of self. So your relationship to you is held in the liver. And because that relationship was under threat, he completely lost connection to himself.
It's a pretty interesting thing. I've got a book or two, one in particular off the top of my head that's excellent at looking at injuries to the arteriovascular system, because I came across a number of cases that had really strange symptoms that I could not identify as visceral or musculoskeletal, but they were often, actually, I saw a lot of these happen after whiplash events in cars, or people getting clotheslined in rugby or football. There's been a few, sometimes impact injuries, but they would get a deep aching pain, often described like a headache that runs down my arm or a headache running down my leg. And so I did some research and I came across a really good book. I believe it's European. A lot of the stuff that you can't find in the United States, you have to go look around through Europe. And so I learned through studying that book ways of changing the pulse wave in the arteries and looking for the symptoms of artery and vein injuries. And it turns out that they're more common than a lot of people would realize. Have you ever come across and worked with any of that?
Daily.
Yeah.
Yeah. Generally, if someone's got a visceral issue, they've got a vascular or venous issue. And a lot of people don't realize that if you took every nerve out of the body, laid it end to end, there's a little under 100,000 kilometers of nerves in our body. For each nerve, there's a corresponding artery. For each artery, there's approximately 1.3 veins. So our physical tissue, if you think of a garden, the crops in the soil would be the tissue. The irrigation system would be the arteries, but the drainage is venous.
And lymphatic.
So all of that needs to be functioning.
Yes.
To be optimal. And unfortunately, a lot of people don't think about the drainage systems.
No, they don't.
And a lot of tissue it's not draining properly. So the pressure builds up and the organs themselves become quite dense. And that's where a lot of fatigue comes from. So it's not necessarily that you're inflamed. It's more that nothing's draining.
I've seen a lot of people with problems that I track back to lymphatic stagnation and some pretty wild things. I was trained in the VODR system of manual lymphatic drainage in my massage therapy training. But there was a couple of massage therapists at the massage center in town years ago. My first institute was in Encinitas, and right across at the Encinitas Massage and Acupuncture Center, there was a couple of people that was their specialty, was lymphatic drainage. And I occasionally would refer people there, but I hung out with those therapists. They were friends of mine. And some of the things that would happen for people after getting proper lymphatic drainage. I remember one guy, he looked swollen and red, like he had a bad sunburn all the time, but it wasn't from the sun. Almost like his whole body was inflamed, like he was just on fire inside. And after, I think, 5 or 6 manual lymphatic drainages, all that completely cleared up. And I think a lot of people's immune system problems come from backed up lymphatic systems, because the body, that system's designed to remove dead protein out of the body. So if you get a bunch of dead protein in the body and it can't be taken out, it starts to rot in the body. And it also is a fantastic ground for feeding parasites and fungal infections. So people can really go on a downhill spiral very quick. And because these drainage systems are all connected, once you start backing up the lymphatic system, it's kind of like the toilet overflowing onto the floor in your bathroom. Anytime you flush it, it just makes a big mess. Mm-hmm. And so because these fluids are internal, it starts throwing pressure regulation off in compartments of the body because you have imbalance in pressures. So if you get too much pressure in the lymphatic system, it actually can make the arterial system have to work harder and the heart have to work harder because it's pressing against internal pressure.
And that will often show up as high blood pressure.
Yeah. And headaches and all sorts of weird. You get a lot of, until you actually start looking at these things and treating them, you don't realize what a lot of the symptoms are that seem weird to people. For example, some of these things can cause ringing in the ears. And people go to doctor because they have ringing in the ears. But oftentimes, it can be that the cerebral spinal fluid's not moving properly in the body because they've got an unresolved trauma, like a head injury from motocross racing or boxing or kickboxing. And so people are just left with all these strange symptoms. The next thing you know, they're on a handful of drugs or getting some kind of an experimental surgery or whatever. But they come back to people like me or you, we do the work on them. And even after the surgery's been done, the pain's not gone. And all of a sudden the pain goes away and they realize, oh my God, I probably never needed the surgery. Well, actually, you're probably correct there.
Yeah, I worked with a guy recently with gum disease and we sorted his gums out just by flushing the lymph nodes behind his sternocleidomastoid in his neck.
That's interesting. That's great observation.
And his gums cleared up. But he was going to get a gum graft about a month back then. It was in a month's time. So he ended up cancelling that. So yeah, he was happy.
Well, yeah. I mean, if you can't get the lymphatic system to drain and there's a lymph vessel that goes to every single tooth. And a lot of people don't realize every time you swallow or bite down, you pressurize the tooth, which pushes lymph through the tooth, which helps keep bacteria from accumulating in the teeth and in the whole mouth structure. So when you think of what happens in there, it just becomes a cesspool or breeding ground for pathogenic bacteria. And then, all the sugar people eat just is like throwing gasoline on a fire. And the next thing you know, you see all sorts of crazy stuff. I've seen, as a side note, I've seen a number of cases in my career of people who had bleeding of the gums and loose teeth, which I track right back to dairy intolerance. As soon as I got the dairy out of the diet, usually it's pasteurized dairy, then all the gum bleeding in the teeth stabilized. And I've talked about this to dentists before, and every single one of them said, I think you're crazy. I don't think there's any connection. I said, you've never actually looked, have you? I tried paying attention.
Yeah. But also with the teeth are the circuit breakers of the body. So they're the end of the meridian.
Right.
In a lot of cases.
Yes.
So a glandular and visceral issue will show up in the tooth. So you work with the actual organ itself and the entire meridian clears up. And then the neighboring meridian, because they all hold hands.
Yeah. Earlier when you asked the question, what would you do if you had 30 seconds? I thought, well, what would my answer be? But my answer would be the first thing I would do is make sure they have a normal breathing pattern. Because I believe that if the breathing pattern's off, then the motility gets affected, the lymphatic system gets affected, the circulatory system gets affected, the whole system gets affected. So, and strangely enough, having now had probably 120 people that have been to Wim Hof and other breathing workshops, I've never found a single one of them yet with a normal breathing pattern.
Yeah.
Not one of them. And I'm like, okay, well, that's interesting. Here you are hyperventilating yourself into DMT hypnosis, but you don't know how to breathe properly. And so you're just driving that faulty breathing pattern right deep into the system, making it harder and harder to correct it. Yeah. And that's another, side note. That's a paradox of what's going on with all the craziness of the breathing exercise. I mean, I'm glad people are breathing out there, but if you don't have a normal breathing pattern, it's like an athlete that has musculoskeletal imbalances going to the gym and training really hard. And the next thing you know, they look good in the mirror, but they can't figure out why they're in pain all the time. And they drive faulty movement patterns so deep into the motor system, it takes a very skilled therapist to get them out. And then an athlete that's got the discipline to do the corrective exercise, which is hard to find someone with that discipline.
Well, last time I had that conversation with the doctor, they said, I've been breathing for 60 years. Don't give me a lecture about breathing. And that was it. End of.
Well, you could say, yes, you've been eating too. And how's that working out for you? Yeah, but that's the mentality, isn't it?
Yeah.
That's the sad story here. That's at the root of all this. That's the sad story.
I mean, that's I'm the doctor, you're no one. You can't teach me anything. So
yeah. That's why I love it when doctors are in pain, because they finally become good students. That's my favorite. When they show up to me begging for help, I'm like, okay, good. Now I got you right where I want you.
Yeah.
And one of my favorite things is when they're the ones that were very resistant to me and giving me a lot of hassle. The pain teacher is very powerful. We live in a world where stress is constant and distractions are endless. If you're like many of my clients juggling family, career, training, and spiritual practice, you've probably felt the toll it takes on your clarity and vitality. You may even be someone that can't get through the day without drinking coffee, even when it's not making you feel better anymore. That's why I'm excited to share something that's become part of my daily ritual, Nandaka by CHEK. Nandaka means the sword of wisdom. It isn't your typical energy booster or coffee substitute. Nandaka is a sacred blend of organically grown adaptogenic and nootropic botanicals designed not to mask your fatigue, but to nourish your nervous system, feed your brain, and support deep, sustainable energy from the inside out. That's what true vitality is all about. Unlike most mushroom products that are stuffed with mycelium grown on grain, Nandaka is made from 100% fruiting bodies. That's where the medicine lives. You get the full spectrum of benefits of lion mane for mental clarity and nerve regeneration, reishi and chaga for modulating stress and inflammation, and ceremonial cacao rich in anandamide, the bliss molecule, to uplift your mood and calm your system. Even the cacao butter serves a higher purpose, acting as a delivery mechanism to carry these nutrients deep into your brain. When I take Nandaka before podcasting, teaching, writing, or conducting a therapy session, I notice something profound. The energy is steady, the focus is clean, and my creativity flows without resistance. It supports the body, the mind, and the soul all at once. And here's the truth. If your brain and nervous system are overstimulated and undernourished, you'll always be inviting burnout. That's why I don't treat the symptoms. I go to the source. And Nandaka aligns with that philosophy. I'm truly impressed with Nandaka, and that's why I'm excited to share this powerful, effective support and nourishment to help you stay vital throughout each day, to bring you many of the core nutrients most everybody's brain, nervous system, and body needs today. Currently, there are over 18,000 five-star reviews on CHEK's amazing products, and Nandaka is trusted by some of the top minds in wellness for a reason, including me. These products actually work. Tune in, reconnect, nourish your core. Try Nandaka and feel the shift. Nandaka is a powerful ally, and right now, you can get 20% off for life, plus a free starter kit with your first order and a rechargeable frother and helpful glass beaker for mixing your Nandaka exclusively at peaklife.com/Paul CHEK. Once again, that's PIQUELIFE.com/PAULCHEK. peaklife.com/Paul CHEK for 20% off for life plus a free starter kit with your first order. Maybe we can talk a little bit about the mechanism by which glands and organs cause pain in the musculoskeletal system or the surface of the body. We've talked about pressure. We've talked about motility. Maybe we can talk a little bit about the distribution of the sensory and motor systems a little bit.
Well, pretty much any symptom you can think of can be traced back to some kind of visceral or glandular. Think bloating, fatigue, inflammation, all of it has a visceral origin on some level.
Yeah.
Even if it's not visceral per se, there's a psychological theme that's imprinted in the organ.
Yes.
Therefore, you get the organ symptom.
Yes.
So the mechanism, the physical mechanism would be the nervous system, but then the psyche influences the nervous system.
Mm-hmm.
The viscera responds to both. And you could argue is the bridge, the subtle interface, you could say, between those. And it brings it all together and allows us to have that experience. Whether it's a good experience or a bad experience, that's entirely up to each different person.
Yeah.
But any kind of symptom you can think of is visceral.
Yes. What I'll share for the listeners is, and I'll try not to make it too technical, but in actual fact, the reason, for example, that patients have chest pain and pain down their left arm when they're having heart problems is because the glands and organs do not have their own sensory systems. So they borrow their sensory systems from the nerve fibers that feed the musculoskeletal system. And that's why when the heart's having pain, it creates the appearance of chest and arm pain because its own sensory fibers are actually connected to and borrowed from the region of the chest and the left arm. And that's the case with all the organs. So in my book, How to Eat, Move, and Be Healthy, for those of you that probably have it, I actually have a diagram in there. I believe it's on page 28 to 32, somewhere in there, depending on which edition you have. It's called the piano spine diagram. And I show you exactly which organs are connected to which segments of your spine so that therapists or people that are doing rehab or even people interested in looking at themselves can say, okay, my liver is innervated by T5 through T9. My lungs are innervated by T1 through T4. And so even if you don't know what the T means, you can actually see on the diagram. And so it helps you make the connection. For example, if you have chronic cervical pain, but you have unresolved grief, that can have a very strong effect on the lungs and can lead to changes in the flexibility and the motility or the movement of the lung, which can then lead to restriction in the upper rib cage or the whole rib cage, which then leads to the cervical spine having to move too much relative to the thoracic spine because it's an integrated system. So whenever you restrict motion in one segment of the spine, you end up causing hypermobility or excessive movement, which leads to chronic contraction of the muscles, the stabilizer muscles, to try to protect that system from breaking down. So the key point I'm making is that all your organs are actually sending the information about their internal state to the muscles, and the muscles, of course, control the joints. So whenever you have dysregulation or imbalances in the organs, it always will produce a correlating dysfunction in the balance of the musculoskeletal system. And so for people that are physical in their work, like house cleaners or gardeners or construction workers or anybody doing any kind of physical stuff, these imbalances can actually become very disruptive and lead to things like disruptions in motor coordination that leads to falls and injuries, or simple things like swinging a hammer and hitting your hand because you don't realize that your proprioception and coordination are being disrupted by the internal systems and their imbalances. So it leads to a lot of actual injuries in athletics and injuries in the workplace that ultimately are coming from diet, lifestyle, and the resulting and psychological stress on the glands and the organs. And, you know, as a younger man, as a therapist, I kept having to ask, you know, I would, you know, I was very diligent with my work and very methodical and scientific about it. But when something wasn't working, it would really irritate me. I'm like, why is this not working? And so, of course, that meant me going to the medical library and doing research and calling up other doctors and therapists and asking questions. And one thing would lead to another. And, you know, there's the rabbit hole you talked about. But early in this quest, one of my buddies who was the editor for my book, my chapter, Posture and Craniofacial Pain, in the book, Chiropractic Approach to Head Pain, Daryl Curl is a dentist and a chiropractic professor. And he was one of the guys I would call about this stuff because he had quite a diverse base of knowledge. And he said, Paul, what you really need is a good book on differential diagnosis. And so he gave me the name of a couple of books that were well respected on differential diagnosis. And that's what really helped me a lot when I studied those books, because that's what they were showing is, what are the different things that can cause the symptom profile that are commonly overlooked. So what I did is I went through all the reference lists in there and started reading all the papers that they used to write the book, which then gave me more reference lists. And so over time, I started actually getting quite a circumferential view of the literature and the research on differential diagnosis. Led me to realizing, oh my God, every single part of the body can affect every other part of the body. Literally.
Oh, absolutely. Yeah. And really the diagnosis is just the symptom, isn't it?
Yeah, it is. Yeah. Unfortunately, it's usually the case. It's not the actual etiology or cause. It's just the most painful spot that the patient complains about. That's what that is. Yeah. It's a really, fascinating field. And, I've been doing this a long time, but I must say I'm still as passionate about it as I ever was. I still put as much time into my study and practice as I ever did, even in the beginning of my career. It's just as you grow, and I know you know this yourself because I've watched it happen in your own life, but once you master the low back or the mechanics of the spine, or you get to where you understand the musculoskeletal system, then you naturally start thinking, well, there's issues going on here that I don't understand. So the next thing you know, you're reading about the liver, or you're reading about the heart or the lymphatic system. And then you go, oh my God, like that. Oh my God, I got to start looking for that. Then you realize what that does. And so, for me, over the course of my career, ultimately it led me to the psyche, because I realized the psyche is the number one cause of most people's problem, and it has the most control over every system in the body. And so I've spent probably the last 15 years in a very deep study of the psyche and behavioral change and depth psychology and, everything that goes with that. And I've found that that's given me more ability to help where people like you and I are really good at getting to the cause of people's pain. I found that what I got to get to is the beliefs and the behaviors that keep them in the same patterns that keep causing the causes of their pain. Like, you can really be really good at enhancing liver motility, but if you're not aware of what people are eating, then you're just, another form of aspirin for the person. Mm. But then you get good at really eating and you realize people don't follow the diet that you gave them because they've got other issues called addictions or avoidance patterns or ... And so then you got to go deeper and deeper. So,
well, I found that with patients as well. If I found a tension in the liver, let's just say, I would tell the patient, there's a lot of tension around the liver. And the first thing they say, I eat pretty well, or I don't drink. That's the first thing they always say. That's fine. But, food and drink come and go.
Yeah.
What's the thing that's with you 24/7?
Yes.
It's the story that you tell yourself.
Yes. That's
affecting you more than any drink or food can. So that's just there on a low simmer all the time.
Yes. And sometimes a hot boil. There's a lot of people with a lot of unresolved anger issues and mommy and daddy issues. Even at, 60 years of age, they're still pissed off at mom or dad, or the ex-wife or the ex-husband. And I mean, like, when you start really getting into this stuff, you realize that, the head is a dangerous place to live. It's like, you don't want to camp out there, man.
Well, it's even scarier to continue taking orders from it too.
Well, exactly. Yeah. But for me as a therapist, it was like, God, I'm probably writing some of the best programs in the world, but the hardest thing in the world is to get these people to do them. They come crawling on their hands and knees. They'll even second mortgage their house. I'll tell them exactly how to get out of pain, and they go not do it. I'm like, what exactly do you think was going to happen here? And, this goes to a side note. One of the big problems we have, and you've heard me talk about this before, I'm sure, is we have the medical system has actually conditioned the public to believe that you go to a doctor or a therapist and they take your problems away. They take your pain away, which is why I say to my students, we do not operate on a treatment model. Because the instant someone thinks that they're going to Matt and they're going to pay 150, 200 or whatever it is for a treatment, they're going to get treated and they don't have to do anything but lay there. And then all of a sudden their headaches will disappear. Their back pain will disappear. And the way I make the point is I say, if I say I'm treating you to lunch, who do you automatically assume is going to pay? Of course you think I'm going to pay. But if I say I'm going to coach you today, you don't make the assumption that I'm going to do all the work. No coach goes out and plays for Kobe Bryant or anybody else. They tell you how to play. And so this is why I teach CHEK professionals. We do not treat diseases that have people. We coach people that have acquired diseases, because otherwise you're in the medical system and that's they'll lock you up for that.
It's funny how you're talking about you writing a program and then the patient's not doing it. It just reminded me of when I used to work in Fitness First. I was working with a lady who said to me up front, I hate exercise, I don't like sweating, but I want to lose 20 kilos.
I've heard that lots of times.
Okay. So I wrote the program, did the program, and every Friday she would go to a seafood lunch with her girlfriends. And she was, in my opinion, she had a reaction to prawns, I think it was. But every Friday, I'd see her Tuesday, Wednesday, Friday, and every Tuesday she was puffy.
Yep.
Red, puffy. And I got to the point where, fuck, what are we doing? Seriously, I'm happy to take your money, but this is what's happening.
Yeah.
But what I realized, what it really clicked for me, and I remembered, what's her name? Is it Angelise Arian? Fourfold
Angelise
Way?
Arian.
Yeah. So the causes of addiction.
Yes, four causes of addiction, yeah.
And then I started to quiz her. I said, what was your childhood like? What was your relationship with your parents like? And they said, my parents were really strict. I said, okay. So then it clicked for me. When I was telling her to not eat the stuff that was causing inflammation, I was creating an unconscious knee-jerk reaction to rebel against mummy and daddy.
Yeah, very common.
And then as soon as I switched, how was lunch? How was the prawns? I just accepted it. That's when she stopped.
Yeah, very good.
And that's when the weight started to come off.
Yes. And that's exactly why I study the psyche so much.
Yeah.
These are really major, major issues. And they're challenges for all CHEK professionals and anybody else out there, because, the problem is, and you'll know this to be a fact, the big problem is that very few people in the rehabilitation system, whether it be any kind of rehab, I don't care what it is, from behavioral to musculoskeletal to visceral to pelvic floor, they don't do proper assessments. So they don't know whether the programs they're giving are working or not. Right? That's why the CHEK Institute teaches you how to use calibrated instruments to measure spinal curves and forward head posture and rib angles and pelvic tilt and weight shift and a load of other stuff, because the first thing that happens when the patient comes back, you find out, you get your own report card as a therapist. Because if they're doing the program and they're getting worse, you know it. So it's like, okay, either I'm missing something or I gave them the wrong prescription. And you've probably heard me tell this story, but I'll share it for the listeners. When I invented the forward head caliper, which, that was when I was, that was in my first year at Sports and Orthopedic. That was 1988. I realized I needed to have a way to measure this because it's too subjective. And I was suspicious because I investigated, how did we come to the conclusion that the alignment for posture shown in books like Florence Kendall's Muscles, Testing and Function and many of the other famous books on posture and muscle function, how do we come to the conclusion that the right alignment is ear over shoulder, shoulder over hip, hip over knee, knee over ankle? Like, I wanted to know, how did they come to that? Do you know how they came to that? By looking at people that were dead laying on a table in a morgue.
Oh, I have heard that, yeah.
That's how they figured it out. So they said, this is what good posture is. It's all based on dead people. And so I said, okay, I need a way to measure this and start testing people. And so what I did is I made a habit of testing as many people as I could. And I was looking for people that had no pain, were fully functional, and had a healthy body. And so I would just go measure people all over the place. I'd measure teams of athletes. I'd measure, go to corporations, and, I'd go to put up a booth at a trade show or something and just invite people for measurements. And I had a bilateral scale and a plumb line, and I would take notes. And so what I found through my own analysis, as an example, is that if someone's head carriage is 0 to 3 centimeters, it almost always is not a problem. Versus zero would be ear directly over shoulder, or zygomatic arch directly over collarbone, which is the dead person laying on the table. But I found as long as their head was within 3 centimeters of that, going backwards, that's a problem. But if they had up to 3 centimeters of forward head posture, they could be completely functional. But once it crossed the 3 centimeter zone, the adaptation the body had to go through to balance the different centers of the body, the cranium, the torso, the pelvis, and the legs, led to too much chronic musculoskeletal stress in the field of gravity. But the point I'm making is people don't do follow-up assessments. So what they do is they just project their own bias on it, or just pretend that it's getting better because they don't want it to not be getting better. And so you end up with people just getting countless hours of therapy that's very, very ineffective. But the punchline of this is, once I invented the caliper and got a patent on it, I started running ads in physical therapy journals and chiropractic journals because I wanted to make money selling the thing. I thought it would be helpful to the industry to actually have a calibrated instrument. And it wasn't about 2 or 3 months. I might have sold, 100 of the things. And I got 3 of them back in the mail. And with letters saying, this instrument does not work properly. I don't think it's calibrated properly. And so I got a hold of each person, tracked them down, and said, it is a calibrated instrument. I said, I can prove it to you. And so I said, some of them had written me a letter and not sent it. And they said, I think there's something wrong with this instrument. So I would show them, okay, go put it up against a doorway. I'd show them there's no way it can be wrong because it's built in calibration. And so the punchline is this. I said, look, now that you know how to use it and that it's calibrated, do you want it back? And they would say, no. I say, why? They said, because every time I use it, the person's head carriage is getting worse. I say, do you realize that that's telling you that the therapy you're doing is making the patient's posture worse? Are you doing a bunch of abdominal exercise? Yes. Are you making sure they can breathe and you're stretching the abdominal wall? No. Are you doing strengthening for the extensor mechanisms of the body? No. So what you're doing is you're collapsing the rib cage and pulling the head forward. You're calling that therapy. And now you're telling me you don't want the caliper back because it's showing you the truth of your program. That's what the freaking thing's for. But they didn't want it back. They didn't want to know the truth. Yeah. And I was just like, oh my God, I can't believe this. Yeah. I was like, what is the world coming to? We have professional therapists that don't want to know the truth of their own therapy. They just want to bill people and go home and eat donuts. I hope you guys are enjoying the podcast. I sure am. By now, most everyone has heard of the healing power and wide variety of nutritional benefits we gain when taking Shilajit minerals. As good as it is, it doesn't taste good at all. Imagine eating rotting rocks that have passed the due date. You're probably about right. But there is an exceptional way I get my daily doses of Shilajit that tastes fantastic. That's Organifi's Shilajit gummies. The texture and consistency of the gummies is excellent, and they have just enough natural sweetness to make me feel like I'm getting a lovely, healthy treat that both my body and mind can enjoy. The only problem with Organifi's Shilajit gummies is that you have to hide them when friends are around, and the kids too, or you'll go through 2 bags in no time. Shilajit is a unique mineral paste from the Himalayan mountains. It contains an abundance of trace minerals, antioxidants, organic acids, and nutrient-transporting compounds. It has been known throughout history to boost vitality and strength. Just pop a couple of gummies in and chew or suck them slowly for a steady release of the delicious, earthly, but slightly sweet natural flavor. Your taste buds will enjoy the delicious treat while your body soaks up massive amounts of feel-good nutrition. Rich with fulvic acid, humic acid, vitamins, enzymes, bioflavonoids, antioxidants, metabolites, and over 40 trace minerals, Shilajit gummies can help support energy production, support performance and recovery, support healthy muscles, promote collagen synthesis, promote healthy hormone levels, increase cellular energy, decrease fatigue, promote health. I absolutely love Organifi Shilajit gummies, and I love knowing that there's something sweet that I can eat that doesn't come with all the challenges most sweet stuff does. If you'd enjoy something tasty that enhances nutrient variety, delivers the minerals your body needs, and helps you look and feel great, don't wait. Get your Shilajit gummies now. Hint, don't just buy one bag because they'll be gone before you know it. Get your 20% Spirit Gym discount on your Shilajit gummies. Go to Organifi.com/CHEK20. That's Organifi, ORGANIFI.com/CHEK20 to get your 20% discount on these amazing nutritious gummies. Poor posture and pain of musculoskeletal origin can cause dysfunction in the visceral system, so it can go backwards. Mm-hmm. Maybe you can share what you've observed with that. We did talk a little bit about car accidents and issues, but I'm talking more about the nervous system and how it functions, or anything you want to share so people understand. You don't have to actually injure the gland and organ. You can injure the body, and it can cause gland and organ dysfunction.
Yeah, I've found several cases with lordotic patients. And I'm saying lordosis, instead of the curve equaling 30 to 35 degrees, they're like 50, 60 degree lordosis. What I find happens...
That's lumbar curve, everybody.
Lumbar curve, yeah.
Forward curve is lordosis. What
I found was that the mesentery of the small intestine, which crosses between, if you draw a line between the right ASIS and the left lower rib cage, that's where the mesentery sits, right on the spine. And to give you an idea of how strong it is, if you were to pick it up from a cadaver, the whole body would go with it.
Wow.
So what I was finding with lordotic patients is it was restricting blood supply to the mesentery and the small intestine. The mesentery provides the small intestine with blood. And so a lot of people end up with nutcracker syndrome, which is where the superior mesenteric artery comes off the aorta, but it can pinch the left renal vein. So a lot of digestive dysfunction. I find with a lot of kyphotic patients, they have a lot of tension in and around the lungs and the pleura.
For those listening, kyphotic means that your chest is dropped down and your head forward, so like a hunchback.
Yeah, so if you were to hunch really forward and take a deep breath in, you can feel where that tension goes straight away. Mm-hmm. So people will present with secondary neck and shoulder issues from that. And what I've found with people with poor posture, it puts an adverse mechanical tension on the phrenic nerve as well. And the phrenic nerve is the nerve in our body that holds any severe trauma or near-death experience. So it also not only affected the viscera, but also affected their psyche because they were in a perpetual state of reliving that near-death experience.
Why don't you tell people where the phrenic nerve and what it does so they don't get lost?
So the phrenic nerve is the motor nerve for the diaphragm, but it also picks up tension from the visceral system and also communicates to both capsules in the shoulder. So the liver will communicate to the right shoulder capsule via the phrenic nerve, stomach to the left. But it's innervated primarily by C4. It does run from C3 to C5, but primarily C4. So anywhere along that nerve channel can present any kind of symptom. But what I found clinically is people with phrenic nerve tension didn't necessarily have neck tension, but they had one-sided rib cage tension or depression, Mm-hmm. And that often showed up as a scoliosis as well. But I found that the psychological theme running the show was they were always in danger.
Well, that'll affect your breathing pattern immediately.
Yeah. So they had that constant tension.
Yeah, gridlock.
Yeah. And then also the vagus nerve as well, because the vagus nerve on its way up or down, however you want to look at it, it holds hands and touches the phrenic nerve. So often tension in one will affect the other.
Yeah.
And so often you have to work with both.
When I studied the anatomy of the visceral system and its relationship to the spinal cord and the pathways, basically what I came to the conclusion was, and I don't know if you've ever heard me describe it this way, but I say that the pathway from the musculoskeletal system to the glands and organs is like a 4-lane highway, but the pathway from the musculoskeletal system back inward, so glands and organs out to the body, to the motor system, is a 4-lane highway, but from the musculoskeletal system in is a goat trail. And having studied, countless journals and case history, books of case histories and things like that from chiropractors and osteopaths, occasionally you'll hear of like a miraculous thing. For example, someone gets their mid-thoracic spine adjusted and stomach ulcer problems that they've had for years clears up instantly. And so you get, for example, I read all the NUCA monographs ever published when I was studying the upper cervical spine, which took me quite a long time to do. But one of the things that popped up in a number of case histories when women had atlas subluxation, for those of you listening, atlas is the top cervical vertebra that your head rides on top of your neck on. They often had severe menstrual cycle dysregulation. And another common problem was bad constipation. And many of the NUCA chiropractors reported that once they corrected a woman's atlas, all of a sudden they would start menstruating, some of them before they could even get them off the table. They would just literally start menstruating, which I thought very, very interesting. So the point I'm making is some of the connections from the musculoskeletal system into the inner systems of the body can be quite open in people. And I think there's a lot of genetic variation from person to person. In other words, you could take 100 women with menstrual problems and constipation, and you could do structural work on them or have a chiropractor find any sublux joint or restricted joint, mobilize it, and they might get very little internal change. But every now and then it'll be like a miracle happened. And so I basically concluded that there just has to be a fair bit of genetic variation in the way we're wired, just like there is, in everything from the color of our eyes and our skin to our digestive ability, et cetera. But the point for the listeners is that if you hurt your body, and by the way, the reason I meditated on this, why would the body be built that way? And so one of the things that came to me is, well, what would happen if somebody was walking and slipped on ice and landed and smashed their left elbow? The intensity of that input could give you a heart attack because it's on the same channel. Or if someone tore a pec muscle while lifting heavy bench press, it could literally overload the heart with so much pain it might shut it down. So my conclusion was that the body has to be much more careful about how much external pain makes it into the internal system, because those are our survival systems in there. And so it will sacrifice the structure of the body to protect the organ system, is what I concluded.
Yeah, I found the same for sure.
What percentage of people's visceral and glandular challenges do you feel emanate from genetic influences versus diet and lifestyle choices versus some form of structural challenge? So if you said, so what I'm saying is, how much of it's genetic, how much of it's diet and lifestyle, how much of it's structural issues?
I would say genetic, lucky to be 2%. I think structural, maybe 5%, and the rest, lifestyle, diet.
So 80 to 85% or so diet and lifestyle.
Yeah, it's I've never met anyone in pain or dysfunction that didn't have a visceral glandular issue.
Yeah,
I remember if it's genetic, it's going to usually show up in the first probably 12 years of life.
Yeah,
but there are those people. It's structural as well.
Yeah.
What have you found with that?
About the same. It's predominantly diet and lifestyle. A lot of the visceral challenges I found, I track back to psychological traumas. And it could include physical abuse, such as sexual invasion, being beat up by your father, real trauma. But I think diet and lifestyle factors are massively problematic.
I think I've found what you were saying was that the trauma happens, imprints on the body, but then you add the diet, the lifestyle onto it, which compounds it further.
It does. Because just think of a chain is only as strong as its weakest link. So once there's a weakness in the system, unfortunately, that's what breaks down first. So if you have unresolved mental emotional trauma and you're not eating well, it'll magnify the mental emotional trauma. If you go to the gym and start pushing yourself real hard, you'll find the weakest link in the chain almost every time. Because the system is, as you know, it's a holistic integrated system. And so the body's moving stress all through it. So just like your 24-hour meridian cycle, each of the meridians is feeding the other. So if you create a disruption anywhere, and it begins at the lungs. So if you have a breathing pattern disorder, every one of your meridian systems is going to suffer for it because it's primarily fed by the lung system. So it creates a domino effect through the body. Now, because of genetics and people that do take care of themselves, you have people that have a lot more capacity to compensate, right? So healthy people are often good compensators. So someone with your skill or my skill might evaluate them and go, oh my God, you've got this problem here, and they don't even know that the problem's been there. But throw them on a shitty diet or give them a period of not enough sleep for about a month, like a woman who's had a new baby, and the devil shows up at the front door.
Shit gets real.
It gets very real. But one of the things I did notice when I was doing visceral manipulation on people is that two things: if they're dehydrated, if the water's got a pH below 7, or if they're eating a poor quality diet that makes the body acidic, that the viscosity of the fluids in the body changes and things get sticky. It feels like things are sticky in there.
Or thick.
Like, when you're dehydrated, your mucus in your nose will get sticky. You can't get it out, or you'll be trying to clear your throat over and over again. It's like glue stuck to your vocal cords or something. I just noticed that if you didn't get the diet and the hydration and the pH of the water right, that it's like the system gets gummed up inside, and it doesn't move well. Have you all observed that?
Yeah, 100%. Also sleep. People who don't sleep very well.
Yeah.
It's like the tissues vibrate.
They can't
all the time.
restore.
They can't relax. Yeah.
Another thing that's simple but causes a lot of problems, I've seen this over and over, and I've noticed it in myself repeatedly, is if people eat too close to bedtime, it puts a hell of a stress on the visceral system because the poor glands and organs don't get to rest all night. And so one of the first signs of that is that they wake up with bags under their eyes or often discoloration, almost like an allergic shiner. But it's often because the body is exhausted from trying to break food down all night, and it just the internal systems don't get any rest. So you get up and first thing you do is eat breakfast, and now you're just loading the system again. So I've found when people are having problems with chronic fatigue, just feeling tired all the time, or any kind of chronic health problems, that I tell them, make sure you eat no later than about 6 o'clock, and eat like you're going to play a tennis match, not like you're going to, sit and watch TV and eat chips and ice cream all night, or it'll kill you.
Yeah, it's the big meaty meal before bed, and their body has to digest not only the food but the thoughts of the day on top of that, and it just compounds, and they never get that rest. Yes,
and so it's such a simple adaptation. The other thing is a lot of people eat such dead food. I tell people, especially if you're eating meat, start with a salad and use a good salad dressing with some cider vinegar or something that's got some horsepower for breaking stuff down. I think cider vinegar is such a magical medicine for people that's, it tastes great on vegetables and you mix it with some olive oil and a little salt and that's all you need. But it gives you so much more digestive power if you eat raw greens and vegetables before you eat the meat, because it helps break the meat down. I'd rather people do that than eat a bunch of digestive enzymes to try to improve digestion of a bad meal. If you're using good enzymes to break down bad food, you're just doing a better job of absorbing garbage. It doesn't, in the long run, you might feel better, but it doesn't work better.
Well, that's the whole supplement thing, right? People take supplements to give themselves the license to eat shit, but then they take the supplements and that just helps metabolize the shit.
Well, exactly. And that's one of the diseases at the core of the whole biohacking movement is just playing tricks on the body to get your dick to stay harder longer, make your brain stay clear, or, make your abs look more ripped. It's just like, oh my God, the crap that I see in the name of biohacking is just enough to make me want to crawl in a hole and cry.
Yeah, I've had many conversations with patients with that kind of stuff.
What are some patterns that you can describe that might help people listening go, oh my God, that might be me? For example, gallbladder dysfunction can often cause pain under the rib cage on the right, if I remember right, and pain behind the left knee. I found, for example, a lot of chronic neck pain with any kind of parasite or irritation of the lungs, such as people that smoke, an actual smoke like a cigarette or a pipe, can lead to hypertension in the trap muscles. Heart, one we've already talked about. You want to maybe share some of the things that people might be able to connect their pain with what might be going on inside.
I'll talk you through my week that I've had working with patients.
I was going to say your week. Oh, Matt, you're not supposed to be having these things. You're the expert.
No, I mean the person on the table. So a bladder dysfunction can cause a locked up sacroiliac joint. It can affect any joint from where in the ilium or from L4 down to the big toe. Bladder can also affect the prostate and or uterus. The bladder will often, same as the uterus actually, I've probably seen more rotated pelvises from a rotated uterus than anything else. Rectum as well. So a lot of pelvic torsion comes back from the aponeurosis between the pubic bone at the front and the coccyx at the back. And if the bladder, uterus / prostate and rectum don't line up, the pelvis will shift in an attempt to get them to line up. And so that can be a lot of scoliosis patients as well. With all of those organs I've mentioned can create lower back pain. I've found people with a rotated, or I call it a bent rectum, where it's not straight, but it's just sort of off to one side, that will lock up the coccyx. And unless the coccyx is released, it won't unresolve itself. So that's what I've found clinically. Moving up, small intestine. People with a tight lower back often have a lot of tension in the small intestine and the greater omentum. They just get that urge to bend forward and stretch out. Lower parts of the colon. I know the cecum on the right will lock up the hip. On the right, it can also pull the shoulder down as well as the kidney. Sigmoid on the left. The flexures, where the flexures are the parts of the colon where it takes a sharp bend.
Turn.
So yeah, and it goes into a different direction. That's a lot of place where the fecal material gets stuck. And parasites like to hang out there as well. That will pull the rib cage down as well.
Yeah. Further
driving breathing dysfunction. The stomach, people don't realize how big the stomach really is. If you've got a full stomach and go all the way down to the pelvis.
Yeah.
And when the stomach's in trouble, it will often talk to the shoulder. It'll restrict circulation to the left sacroiliac joint. The liver refers to the entire body, I've found, everywhere from your big toe, sacroiliac joint, lower back, mid back, shoulder,
right shoulder, neck,
cranial base, temporal headaches, eyesight.
Even pain in the eyes, I was going to say.
Yeah. The kidney and the liver, huge with the eyes. That's all I've seen this week. And then...
That's funny. It's funny, but it's not funny, is it?
It's funnily not funny, yeah. I mean, people with lung tension will often cave into themselves. They'll bring their shoulders together. They'll appear kyphotic.
You know, it's worse when women have that problem. They go get a boob job because they think their boobs are sagging, and they make it worse. Yeah, because it winds the fascia up something fierce when they do that, and now they put insult on injury.
Mm-hmm. I'm working with a lady at the moment who's just got the implants out.
Good,
but she's dealing with the aftermath.
Yeah,
I found the thyroid, when it gets rotated, it can irritate the fascia surrounding that, and I've found it. One pec will often tighten up more, and it's usually the side that it's rotated towards, just from the pectoral fascia, and now it goes into the mid-cervical fascia. So the symptom list goes on and on and on.
I find that problems in that region are often connected to bite imbalances, occlusal disruption, and eyes, and occasionally inner ear, and very frequently atlas problems. Because if the head's not sitting right, it throws an imbalance into the submandibular muscles, and it tends to pull the whole thyroid complex off to one side. And that leads to a lot of disruption of the energy flow in that region. And it also sets up trigger points in those muscles, which can themselves cause tremendous disruption in normal thyroid function and regulation.
Yeah, it just reminded me of a patient I had years ago. I got him on 2 scales, and he came to me because he had mid-back tension, and he kept rolling his right ankle. He worked in the mines. Got him on 2 scales. He had a 32-kilo weight shift to the right.
Wow, that's a lot. That's 64, 65, 66 pounds.
He currently holds the record.
The worst I've ever seen is 57 pounds.
Yeah. So I worked with his jaw, and then I eventually got it to 4 kilos the other way. So
that's a good little overcorrection.
Yeah. And then the mid-back tension was actually coming from his bladder and his liver. So the urachus ligaments, the umbilical ligaments attaching from the liver down to the bladder was rotated. So it was causing the liver to rotate, which is doing that shearing effect, affecting the aorta and the vena cava. And as soon as I did that, he stood up dead straight. And he said, I can feel my ankle for the first time. So it's just an example of how, the totem pole works.
Yeah.
But also how influential the jaw is as well.
Yes. Mm-hmm.
It's a huge player.
If you have listened to even one episode of Paul's podcast before, then you will know that he is passionate, and some would say even fanatical, about the quality of the food he eats and where it is sourced from. That is why the CHEK household only eats pasture-raised meat, wild-caught fish, and organic produce. And that is why we subscribe to Wild Pasture's meat delivery service. Each month, Wild Pastures delivers a box of meat that has been raised by family farmers in the USA using regenerative farming practices. 100% grass-fed and finished beef, pasture-raised chicken, and pasture-raised pork, as well as wild-caught seafood. You can customize the selection in your box, add on extra when you know you will be feeding more people, or change your options each and every month. You might be thinking that this will be too expensive for you, but Wild Pasture's mission is to offer the highest quality meat at the lowest prices because they want to transform the meat industry. And that means that more people need to be able to choose meat that is raised right. Their pasture-raised animals are part of a natural ecosystem. Their farmers use rotational grazing, practices that mimic nature, and so do not need to use synthetic fertilizers, pesticides, herbicides, hormones, or antibiotics. This beautiful process doesn't require the external resources, such as massive amounts of GMO grain, required with environmentally depleting conventional methods. And best of all, the meat and fish taste amazing. And for Paul's listeners, Wild Pastures are offering you 20% off your subscription for life, $15 off your first order, and free shipping. Seriously, you can't find a better deal for top quality pasture-raised meat. Go to wildpastures.com/PaulCheck. You don't need a promo code. Just visit wildpastures.com/PaulCheck and start choosing the goodies you will have delivered to you in your first box.
I'd like to ask you your thoughts on the correlation between organs, glands, and their health and the health of our emotional state. But also, I think I recommended to you to read the book Body Eloquence by Nancy Mellon. Did you ever get a hold of that?
Mm-hmm.
Isn't that an amazing book?
Oh, unbelievable. Yeah.
It's one of my favorite all-time books in my library, and I use it as a reference tool a lot, have for years. I got it when it first came out, and it blew my mind. But that's a great book, not only for seeing these correlations, but getting to the story that's connected to each of the organs, which I really think is phenomenal. And I found it to be really accurate, which is impressive. And I had a great podcast with Nancy Mellon. Did you get a chance to hear that?
Yeah, I did. Yeah.
Yeah,
Amazing.
She's a fun lady, 84 years old and still just on it,
Yeah.
But anyhow, what's your thoughts in that regard? I'll preface this also by saying a lot of this original information about the connection between emotions and organs comes from traditional Chinese medicine, which is based on the study of nature. So it's based on the study of what they see happening in nature and how it correlates to what's happening in their bodies. And I'll give an example from my own life to make this point. When I went through a divorce with my first wife, I really had this inner sense that I had to get next to the ocean.
Mm-hmm.
The emotional pain was quite intense, and just my inner voice was saying, move to the ocean, move to the ocean. And so I found myself an apartment 1 block from the beach up a steep hill, and I could look out my bedroom window and see the waves crashing on the ocean. And it was so loud, it literally sounded like the ocean was right in my apartment when the windows were open. And I found it deeply emotionally healing. So there's an example of how one's own inner nature tells you how to use a relationship with outer nature to heal emotional stress or trauma. And without going through a lot of other examples, a simple one is, I think a lot of people find when they're under a lot of emotional stress, sitting next to a fire is very emotionally healing. There's something very primal about it, and it gives us a sense of safety and security, because fire created a lot of safety and security, protection from animals, cooking food, warmth. So I think for the listener, it's important to realize that the correlation between glands, organs, and emotions is not something that someone just cooked up. It's a very ancient practice that came from deep observation long before people had television and radios and phones to distract them. So they were deeply connected to the environment and to the stars. And in my career, I've, and you know how I teach holistic lifestyle coaches to do these assessments. I don't think I can remember a single case where I could not find the exact correlations that are given in traditional Chinese medicine and what the patient's case presented. So maybe what are your observations and thoughts in that regard?
Yeah, it's funny because this information is not new.
No.
It's been around longer than medicine.
Longer than paper.
Yeah. So what I find with the visceral emotional stuff is people that hold grief, we hold grief in the lungs. We hold anger in the liver, but also in the liver we hold people who feel like they're a prisoner of their own routine. That's stored in the liver.
Mm-hmm.
Criticism is small intestine. Literally holding on to shit is the colon. And bladder's, fear of confrontation. And the list goes on and on.
I think anxiety is in the stomach, isn't it?
Anxiety, social anxiety is in the stomach, and the anxiety that we hold in the relationship between us and us is more duodenum.
Okay.
I've found. But what I find with people with these visceral emotional issues, we'll call them, they always have an innate calling to go back to the beginning. And what I mean by that is they go back to the elements: earth, air, fire, water. So as you were saying, going back to the water, sitting in front of a campfire, grounding, just getting on the earth, breathing.
Being in the trees and breathing, negative ions.
Yeah, it's almost like it's a system reset, and the body knows it needs it as well. Unfortunately, people get caught up in the trap of their own story, which is, I can't sit still to breathe or to go for a dip in the ocean or whatever that is, because they're so busy going to work, working 75 hours a day to make all the money that they arguably don't really need, to buy shit that they don't really want, to impress people they don't like.
Right. How is that? Buy shit you don't want to impress people you don't like.
Yeah. So that's the story, right?
Yeah.
And so I've found that they just wear themselves out by living everyone else's stories. And, oh, God, we're funny creatures, aren't we?
Yeah. I think there's an underlying theme to our conversation today if one's paying attention, and that is the further you get from nature, the more trouble you're in.
Mm.
One of the things that came to my mind while you were talking, by the way, that I wanted to highlight from our earlier conversation is, and I'm sure you've seen this, but I've seen as we have more and more electromagnetic pollution, more routers and phones, that all the imbalances in the fascial system, including the visceral fascia, are getting worse and worse because fascia is an electret, so it's sensitive to electrical currents, and it constricts. The more electromagnetic energy you have in the environment, the more the fascia winds itself down. And I had a real painful confirmation of that. You remember years ago when I had that guy fall on my head, and it blew two of my discs out and tore ligaments in my spine, and it pinched my spine. It really fucked me up, to say the least. But my neck was it felt like I had an ice pick going through my neck for a long time, several years. It took me about 6 years of infant development work and self-treatment of the soft tissues and neck exercises of various types and Feldenkrais exercises to get it to where my pain was manageable. But Penny one time commented, she said, you do realize about every 3 months you're rolling over so much at night, you're burning these huge holes in the sheets. And I keep having to buy new sheets. And of course, I didn't realize that because she would change the sheets and I wouldn't see them. I get out of bed really early in the morning when it's dark, and when I go to bed, it's dark. So I'm not really lifting the covers up to see the holes in the sheets. But it dawned on me, shit, I totally forgot some of the advice I give my patients, which is to shut the router off and turn off the Wi-Fi system in the house. So she triggered me, and I said, shit, let's turn that off tonight and see what happens. It was the first night for years that I slept with no pain in my neck. And I woke up and my whole body felt relaxed. It felt like for the first time I was actually really getting a healing effect. And I think that people need to be aware that, our body is largely fascia, and fascia is, about 98% water, and water is exquisitely sensitive to any kind of electromagnetic energy. And so I just wanted to throw that out there. If a lot of people are having any kind of chronic pain, it's a good idea to try just shutting the wireless system completely off, the router off, turn the system right off. And it could change your life.
Yeah, it certainly did with me, because I did a similar injury, not that I was pressing someone above my head, but I blew out C6-7 on my left, and I found the most painful was sitting at traffic lights in the car. For me, that was the most painful. But what I did a similar trick with turning the Wi-Fi off at night. I turned my phone off
Yes.
while I was driving, and that made a huge difference.
Oh, yeah. Those phones are friggin' powerful, man. They're getting more and more powerful too, and it's a real. I mean, look at the size of the damn things now. These new iPhones are like, miniaturized laptops that you carry in your purse and pocket. Angie got a new one a year or so ago, and I picked the thing up, and it's like a brick. It's so heavy. It's like, oh my God, the amount of technology packed in there and the intensity of that thing. It's just, people don't realize how dangerous these things are to our health and to our environment.
But especially when you consider what it takes to power the thing, like the operating systems.
Yes. The other thing that I wanted to bring up that I think is important for people to be aware of is, when you see an animal in nature get traumatized, the first thing it'll do is it'll walk over and find some place to hold still, and it'll shake, and it'll shake its whole body out. I've studied what's called shaking medicine. And many native tribes had a practice of shaking medicine. So after there was a trauma, they would actually practice shaking it out and do these dances. It almost looked like, jittering and just letting the whole body shake. And I've experimented with that on myself, and it's really powerful. When we hit our finger, for example, with a hammer, or pinch our finger in a door, the first thing we do is shake it out, right? I could explain the anatomy and physiology of why that works, but it's not important. But I think if a lot of people would just let their body guide them into more of a natural unwinding, it could be very therapeutic for people.
That tension has to go somewhere, right?
Yes.
And if there's too much energy, if you think of the fascia system as the body's wiring system, if there's too much energy going through a circuit, you blow the fuse. And eventually, well, we call that blowing the fuse, we call that pain or disease. But then shaking it out helps wriggle it loose.
Dissipate the energy.
Yeah.
It moves it around too. Helps the body move the stress around and attenuate it through the whole system.
Yeah.
It's amazing how some of these simple ancient technologies that have been forgotten about, if just used more regularly, would really help a lot of people. And I think one of the things that is important to me that I learned in my own observations is if you keep having a pain and say shaking, but the pain keeps coming back, it means that there's something causing it that you're overlooking. So the shaking, or any of these natural approaches, sitting by the fire, sitting by the ocean, breathing better, can alleviate symptomatic stress. But if it keeps reoccurring, it means that you haven't got to the root of the issue, and you should, hire a skilled CHEK professional or someone like yourself that has the diagnostic skills to get to the root of it before it actually becomes something potentially much more serious and threatening.
Yeah, I mean, when it comes to therapies and all that kind of stuff, we probably had it figured out a couple of 100 years ago, but now we're just too smart.
That's a sad giggle right there. It's the sharpness of, Lao Tzu says it's like sharpening a knife so much it gets dull. We get so impressed with our intellect that we actually don't realize that we're overlooking most of the important things. What percentage of people that are having organ and gland dysfunction and probably loads of musculoskeletal system dysfunction are having it due to the side effects of medical drugs?
I couldn't give you a number, but it's high. I mean, everything that we eat has a hormonal consequence.
Yeah.
And it's funny when it's a sad funny that doctors don't do a lot of nutrition training.
Only 4 hours on average.
Yeah. And I read somewhere that a lot of doctors put shit on chefs for giving nutritional advice. Yet I read somewhere as well that the doctors receive their nutritional training from chefs.
Well, that's probably better than most nutrition schools these days.
Yeah. But then the doctors ignoring the nutrition they spend their entire careers treating diseases
caused by nutrition problems.
Right? So I think it's funny with medication causing side effects, they don't tell you how the side effects come to be. So, for example, you might take something for a headache, a pill for a headache, but then one of the side effects is constipation, but they don't tell you how that constipation is there. And more often than not, in my experience, it's actually because of either venous congestion or an asymmetry in the vascular tree. So, for example, you go to the doctor, they take your blood pressure, but they only take it on one side. But if they take it on both sides, they can see what the whole thing is. And many times I've had patients on headache medication and I feel their radial pulse, or their ophthalmic pulse, and it's really diminished on one side, and they got the symptom on the left. But then if whatever side the pulse is weaker or slower, then there's a blockage somewhere on that side,
which pressurizes the other side.
Yeah, if there's not enough pressure on the right, there'll be too much on the left.
Yes.
And so that creates the imbalance, and then the body has to adapt to that. And everyone has their own, subconscious strategy on dealing with that. So it's, again, it's how the side effects come to be, but also how the psyche interprets that as well. So then that just reinforces the loop. And then they need another medication for the loop.
Oftentimes they make no connection between the fact, I'm taking this drug and I've got this symptom. So they treat the symptom as though it's another problem altogether, as opposed to, once I started taking this drug, I started having the symptom. I wonder if it's the drug. The thing that I see is the biggest problem with most drugs is that it's just such a significant toxic burden on the body. And most people's detoxification pathways are already so overloaded. Once you throw the drug in there, then, you put the body under tremendous stress. And so the side effect of that, your detoxification system is, as you know, your liver, your kidneys, your urine, your feces, and your breath. Those are the main systems, but the musculoskeletal system also helps detoxify, which I learned about years ago because I studied, I was reading a journal, and it had an experiment where they brought two people and they broke them into two groups and they gave them a very high dose of caffeine. I think it was 1,200 milligrams, which would be, one cup of Starbucks coffee on average is about 300 to 350 milligrams. So you'd have to drink about 4 or 5 8-ounce cups of Starbucks coffee to get to 1,200 milligrams, which for me would make me sweat like hell and shake like a leaf and feel like shit. But a lot of athletes use doses like that for things like marathon running and, track and field events and, cycling. There's lots of athletes that jack up with that much caffeine. But what they did is they then put one group into a bodybuilding routine, and they actually selected bodybuilders to be in that group because they knew how to push themselves. And in the other group, people just did their normal thing, just walked around, and then they would measure how much caffeine was still in their blood at intervals. And they found that the bodybuilders, people lifting weights, cleared the caffeine much faster than the people that weren't doing any exercise. And so I don't think anybody's really figured out exactly the pathway, but basically the consensus was that the increased thermogenic energy in the body through weightlifting and stimulating the metabolism actually causes the caffeine to get metabolized in the muscular system, like putting it into a fire as a metaphor, a chemical fire. And there's other studies showing things like that. So I think, a side note there, exercise is very helpful to detoxify the body, not to mention the fact that it often makes you sweat and breathe more. But having looked at the side effects of drugs on thousands of my patients, it's very, very common that the side effects of the drugs turn out to be exactly what they're coming to me complaining about. I'll never forget when I first looked up the side effects on Vioxx, which is for years the most commonly prescribed anti-inflammatory in the world for inflammation problems, tendonitis, and back pain. Guess what the first two side effects listed were? Inflammation and back pain. Exactly what they give the drug for. I'm like, oh, this is just fucking ridiculous. And so I found, because so many of these patients were, coming from orthopedic surgeons, tons of them had been prescribed this stuff. So it was making their back pain worse. It was making their inflammation worse. And so I would ask the doctor, can we take them off of this? Because I don't know how much of this pain and inflammation is coming from the drug and how much of it's actually coming from their injury. And so, 90% of them said no, and they just thought I was crazy. And I said, well, look, here's the side effects right here. Oh, I've never seen that. Oh, you never look for it, for Christ's sakes. But anyhow, I just think people need to be aware that if you're on any medical drug, one of the most important things you can do is look up the side effects, but you don't want to do a general web search, because most of the websites that share the symptoms of drugs are owned by and published by drug manufacturers. So a special tip for you is look up the book Drug Facts and Comparisons, because the publisher of that book is not backed by a medical company. At least it wasn't years ago when I checked into it. And the research that they present is factual. And if you compare what's in Drug Facts and Comparisons to any of the other sources, you find all sorts of side effects listed in Drug Facts and Comparisons that are not in the standard systems. And then you'll know what your drug's doing to you. And you'll know how much of what you think is going on is actually coming from the drug. But anyhow, I just thought I would ask you that, because there's so much drug prescription out there now. I can't remember, Dr. Mercola published an article not long ago showing that almost every single man, woman, and child in America is on at least one prescribed drug. Prior to that, I did research and found that 85% of people worldwide are on at least one prescribed medical drug. When you think of that from a financial perspective, it's like, no wonder these companies can afford to buy governments and rape and pillage and get away with everything. They got more money than God from all this.
I credit where it's due. It's a good business model.
Yeah, that and religion, they're the two winners.
Yeah.
Matt, when it comes to athlete and people in general, how much do you feel effective joint mobilization, tissue mobilization, such as the effective use of the foam roller and stretching, can help normalize our gland and organ function, or ease it, or be prophylactic or preventative?
I would say foam rolling, any kind of physical manual mobilization is really helpful when there's a bilateral joint fixation. So if a joint is fixated on both sides of the spine, for example, then it's really effective. Not so much effective if it's one-sided. Then it's usually that joint is a witness to the visceral tension, I've found. Have you found that to be the case as well?
It can be, because I teach scientific stretching, not general stretching. I think when people just do general stretching, they're not bringing the body toward balance. But because the motor system is also a great vehicle for emotional expression, when people are angry or frustrated or insecure, it almost always shows up as stress in the motor system and leads to tension in the body. And then you get asymmetrical patterns. So anger in the liver is on the right. So you can get right-sided chest and right-sided abdominal and right-sided hip. But I found that if you balance the body through stretching by stretching only what's tight, and you do foam roller and various other self-mobilizations, such as using a foam roller to mobilize your spine, that it can have a really good balancing effect on the body, stress relief effect on the body, and it can be used as a diagnostic. Because if you're stretching correctly, after a period of time, for most people, you'll actually balance the body, and you won't be tight over and over again in the same places. For example, if someone's got tight hip flexors and they stretch them properly, if it's tightness that's, could be emotionally driven, it could be a number of factors, then what you'll find is that the body, you don't need to keep stretching it. It actually balances itself. So you go back to the gym and you go, oh, look, my quads are not tight anymore. My psoas isn't tight anymore. And that was how a healthy body would respond. For example, someone might have got hit in martial arts or tackled in football, stressed a region of the body, and then so the flexibility program can balance it out. But if a person keeps going to their stretching routine and finds repeatedly, day after day, week after week, the same imbalances there, I say that's an indication that you've got something coming from the inside, or you've got a joint subluxation or malocclusion or ocular dysfunction or any of the things on the totem pole, and you need to go deeper. But I've seen in myself and in countless cases that when people do a properly designed stretching program, it can have a very, very good therapeutic effect. But if it doesn't, it's also diagnostic, is what I'm saying.
Yeah, the corrective stretches are like tuning the guitar, right?
Exactly. Yeah, or balancing a bicycle wheel.
Yeah. So when you get the alignment right, you make beautiful music and have a fun ride.
Yeah, and then the system can dissipate stress, so it's less likely to fall out of balance because it's able to compensate. It can attenuate shock and stress effectively. But when it's out of balance, every insult makes it worse, and so the imbalance just gets worse and worse until something breaks. We talked a little bit about breathing. I think the most important thing I wanted to share is if you don't have a healthy, normal diaphragmatic breathing pattern, it can lead to a long laundry list of problems that lead to doctors and drugs, such as anxiety, for one, digestive trouble, circulatory dysfunction, autonomic dysregulation, headaches, chronic muscle tension throughout the body. Those are just a few right off the top of my head. Do you feel that that's something that is also important to look at when you're dealing with gland and organ dysfunction?
Oh, essential, because it's the breathing mechanism that helps the organ motility. It's the primary respiratory mechanism that essentially drives that, and to tap into that as well, the craniosacral rhythm as well. So all need to be assessed. I would assess those every session.
I typically do as well. And I don't necessarily mean that I actually do a structured assessment. I'm always watching because I find the assessments much better when they don't know you're assessing.
Yeah.
Now, we've talked a lot about visceral manipulation and all the things that we've covered today, but most people wouldn't be at all aware of where you go to get help from someone with the kind of skills that you have. And granted, there's not that many of them out there compared to other types of therapists. So what are some organizations out there or suggestions that you can offer listeners for where might you find someone skilled at this work? But before you say that, there was a thought that came to me that I wanted to share with you. I have had a number of craniosacral therapists in my workshops tell me that there's no connection between the craniosacral rhythm and the breathing rhythm. And I look at them and say, I can prove you wrong really easily. And they go, yeah, well, let me see you do it. What's the craniosacral rhythm of a dead person? Nothing, because they're not breathing. And people that don't breathe, they're called dead people. So if you don't think there's a connection between the craniosacral rhythm and the breathing pattern, you're missing something very vital in your thinking process.
Yeah, that's kind of sad to hear, because I studied craniosacral therapy through Upledger, and Upledger was considered to be one of the founders of craniosacral training, and the first thing he mentions is breath.
Yeah, great.
So yeah, it goes to show that how many therapies get
bastardized.
Chinese whispered throughout the ages.
Or the problem I've had with the CHEK system, someone gets a little training and goes out and thinks they're going to outsmart John Upledger and starts their own system. And next thing you know, you got a bunch of half and quarter trained people that are getting hand-me-down knowledge, and you know how that goes.
And then somehow at the end of the day, it's all your fault.
Yeah, of course.
Yeah. So with therapists, I know the Upledger and Burrell Institute websites, they would have a directory. So it's burrellinstitute.com.
Barrel, if I remember right.
Yes, correct. And Upledger, Upledger Institute.
John Upledger.
Yeah, they would have worldwide directories.
Yeah, and they you can find people in whatever country or state you're in. And do you remember if those list the level of training that their practitioners are at?
Yeah, they should, definitely.
Yeah. So obviously you want to go for the person with the most training if you have a choice of more than one in your area. Well, great. I wish there was more organizations out there doing that. If you can't find somebody that does visceral manipulation, but you think it might help, my suggestion would be see if you can track down a craniosacral therapist, and the Upledger Institute also trains those, because I've seen a lot of these types of problems clear up when craniosacral rhythm is restored. So that's another option. The other option, too, is just get my book, How to Eat, Move, and Be Healthy, do the stretch tests, go to my YouTube channel, youtube.com/Paul CHEK live, and then search Paul CHEK foam roller, and I show how to release the front of the body, which is an osteopathy is called the front panels. So I show you a specific approach to going through and releasing the chest, the abdominal wall, the hip flexors. And I found that is a really great tool for helping a lot of people. In fact, I remember within about a week after I published that video on how to release the front of the body, I got an email from a lady who was, I think, 78 years old. She had suffered from chronic depression for over 20 years. She was on, if I remember right, 2 or 3 different psychiatric drugs. And she said after she did the foam roller, followed my routine, she played the video and did it with me. She said her depression cleared up. And she did the foam roller routine every day. And she said after, I think, a couple of weeks, she had 0 depression and told her doctor she didn't want to be on the drugs anymore. So sometimes because the abdominal fascia gets and the chest gets so tight, and we have so many common imbalances in the hip flexors due to lumbar spine disorders, it can have a very far-reaching effect, even alleviating depression. So I like using, I'm like Hippocrates, first do no harm. Start with the non-invasive stuff that won't hurt you and see what happens. And then if that doesn't help, find a skilled therapist, a CHEK professional, the CHEK Institute's website. So Matt, it's been a great journey. I really appreciate you spending this time with me and sharing all this information. I don't think there's very many podcasts in the world that look at this stuff. Would you like to share any final comments, resources, contact information, services, or I think you have some courses that you offer and you've written some books. So where do people find you? If they want to be a client, how do they do it?
Yes, I'm quite reachable. My Instagram is Matt Sorensen, HHSORENSEN. I did have a mattsorensen.com, but no one knows how to spell Sorensen, so they never got through.
What's the HH?
Heel Hub, that's my business.
Oh, so is it Matt Sorensen or HH Sorensen?
Matt Sorensen, HH.
Matt Sorensen, HH.
And so then my personal website is heelhub.net. So you can reach out to me there. I've got, 2.5 books. I've written 2 books, one, Doing the Wrong Things Right, which is essentially, I think your story is similar, Paul, why you wrote How to Eat, Move, Be Healthy. I was sick of just telling the same information. People aren't going to quit coffee, so if you're going to do the wrong thing, do it the right way. Right.
Yeah,
so
good idea.
That was the inspiration behind that book. And then I guess kind of Dad was the inspiration behind the second book, which is What Pain Is Telling You. That your diagnosis is just the symptom. And that's just to give you another way to look at things, another way to think about things. And the Half book was really, it's an online program, but it's also a book. And whatever's in the book is the stuff I forgot to put in the program. So hence the book. And that's available on the website as well. That's called The Missing Link. And that was inspired by lockdown. And my girlfriend who I was with at the time, her dad took his own life. And so it was really a inspiration about how to work through that as well. So it's more dedicated to that. And so they're the 2.5 books. And I've also got a number of online programs on my website.
And is there a discount code or anything for listeners?
Yes, CHEK 30, CHEK 30, all in caps. 30% discount for everything.
Okay, that's fantastic. Great deal. You hear that, guys? Go check it out. Remember, Matt's an instructor for the Institute, so he knows how to build a good, solid course. So, all right. Well, thank you, Matt. What a great journey. And I hope all of you listening really enjoyed this beautiful podcast. Really like getting to sit in, almost like being in a CHEK Institute training program today for everybody. This is what it sounds like, except we do the hands-on part of it. Yeah. And Matt, great to catch up with you. It's been a long time since you and I just had a chance to just talk about things that are interesting to us together. So that's fun.
Yeah.
And thank you to all of you for taking care of yourselves and being the change the world needs now. As Lao Tzu says, if you want to change the world, change yourself. So it's not as hard as you think. Thanks to my sponsors for your awesome products. Everything you buy from my sponsors supports companies that are concerned about the ecosystem and each of you, and they buy their source materials from biodynamic, organic, and free-range farms. So you're supporting the podcast, you're supporting yourself, you're supporting ethical, moral companies, and you're supporting the farmers and the soil. And that's a big win for all of us. And I will look forward to seeing you in a week with something hopefully just as amazing and awesome as our session today. So lots of love. Matt, once again, thanks, buddy.
Thanks, Paul. Thanks, everyone.
Thank you for listening to Spirit Gym with Paul CHEK and today's guest, Matt Sorensen. Matt works with clients in Sydney, Australia and online, and is offering listeners special discounts off his programs at healhub.net/programs. Use the discount code CHEK30 at checkout. That's CHEK30 at checkout for your special listener discount. You can find Matt's books, The Missing Link and What Pain is Telling You, in print and ebook versions on Amazon and as audiobooks on Spotify. Check the show notes page for the links. To find out more about Matt's services, check out his website at healhub.net. Follow him on Instagram at Matt Sorensen HH, and listen to his podcast, The Wizard and the Priestess. For more interaction with Paul and to share ideas and ask questions about the topics discussed in this podcast, we invite you to join his Spirit Gym community and program. There are 3 levels of membership to fit your budget and lifestyle, where you can participate in live Q&A sessions with podcast guests, access the members forum within the Spirit Gym community, attend weekly virtual meetups with Paul, and study his comprehensive Master Key online program. Explore the options and subscribe today by going to myspiritgym.com. And finally, if you enjoyed today's episode, please consider leaving us a 5-star rating and a warm review on the podcast platform of your choice. This podcast is available on Apple Podcast, Spotify, Amazon Music, Audible, and YouTube.